Good evening. This is the House Committee on Health and Human Services. Today is Monday, March 8th, 6 p.m. We are in the room 35 at the State House. A good number of our committee members are here in person, and we do have people coming to us virtually via live feed. Clerk, if you're ready, could you please take the roll?
Yes, Chairman. Chairman Casey.
Here.
Representative McLaughlin.
Present.
Representative Donovan.
Here.
Representative Ackerman.
Here.
Representative Azzanaro. We have to hear your voice.
Here. Here.
Okay. Representative Bennett.
Here.
Representative Bia.
Here.
Representative Kassar.
Here.
Representative Fogarty.
Here.
Representative Giraldo.
Here.
Representative Handy. Representative Morgan.
Present.
Representative Potter.
Here.
Representative Roberts.
Says 5019. Right in the front.
Representative Speakman.
Present.
Okay, we do have a quorum, Chairman.
We do have a chairman. Is that what you were going to say?
I corrected myself.
Thank you very much. I appreciate the recognition. Okay, so right now we are going to take two bills for consideration. The first one is House Bill 5462 by Representative Edwards. This is relating to animal and animal husbandry, providing that trapping and subsequent release of unowned, feral, or free-roaming cats for the purpose of spaying or neutering shall not be considered abandonment. Can I have a motion for passage, please? So moved by Representative Giraldo. Second?
Second.
Representative Potter on the second. Clerk, can I have a roll call vote, please?
Yes. Chairman Casey.
Yes.
Representative McLaughlin.
Yes.
Representative Donovan.
Yes.
Representative Ackerman.
Yes.
Representative Azzanaro.
Yes.
Representative Bennett.
Yes.
Representative Bia.
Yes.
Representative Kassar.
Yes.
Representative Fogarty.
Yes.
Rep. Morales.
Representative Giraldo.
Let
Yes.
Williams sit right there.
Representative Handy. Representative Morgan.
Yes.
Representative Potter.
Yes.
Representative Roberts.
Yes.
Representative Speakman.
Yes.
Okay, Chairman. 1, 2, 3. We have 14 in favor, Chairman.
Thank you. House Bill 5462 passes and will move to the floor. Next, we have House Bill 5431 by Representative Ackerman regarding the Restroom Access Act, requiring all retail establishments with 3 or more employees on the premises without an accessible public restroom to allow customers suffering from eligible conditions access to their employee restroom. Can I have a motion for passage? So moved by Representative Ackerman. Can I have a second, please?
Second.
Second by Rep. Giraldo, Rep. Kassar, and somebody online.
Hey,
Representative Bennett. Thank you, sir. Chairman Bennett on the second as well. Clerk, can I please have a roll call vote?
Yes, Chairman. Chairman Casey.
Aye.
Representative McLaughlin.
Aye.
Representative Donovan.
Aye.
Representative Ackerman.
Yes.
Representative Azzanaro.
yes.
Representative Bennett.
Yes.
Representative Bia.
Yes.
Representative Kassar.
Yes.
Representative Fogarty.
Yes.
Representative Giraldo.
Yes.
Representative Handy. Representative Morgan.
Yes.
Representative Potter.
Yes.
Representative Roberts.
Yes.
Representative Speakman.
Yes.
Okay, that's 14, Chairman.
Thank you. House Bill 5431 will pass and move to the floor. Okay. The remaining bills on the calendar will be taken out of order. I'll be taking care of a few different things in specific order, and we may bundle some testimony. So if you will grant me that leeway, not so much that I have to ask for it, but I'm letting you know what's happening. Representative Donovan, if you could have a motion to hold all further bills on the calendar for further study.
So moved.
Representative Donovan moves. Any seconds, please?
Second.
Second by Representative Potter, Representative Bennett, Representative Ackerman. Clerk, when you're ready, I'll have a roll call vote, please.
Chairman Casey.
Aye.
Representative McLaughlin.
Aye.
Representative Donovan.
Aye.
Representative Ackerman.
Yes.
Representative Azanaro.
Aye.
Representative Bennett.
Aye.
Representative Bia.
Yes.
Representative Kassar.
Aye.
Representative Fogarty.
Aye.
Representative Giraldo.
Aye.
Representative Handy. Representative Morgan. Representative Potter.
Aye.
Representative Roberts. Representative Roberts. Representative Speakman.
Aye.
Okay, that's 13, Chairman.
Thank you very much. Okay. If I could have all the attention of all of our virtual members, could you please mute yourselves until either called upon or until you would like to speak? Thank you. Okay, first, Representative Lombardi, are you with us?
Yes, sir.
Okay, Representative Lombardi, I'm going to have you introduce your bill, and for the committee, we're just introducing this bill. Representative Lombardi has another commitment. He's going to introduce his bill. We will hear the testimony on it later. I'm just going to allow him to introduce it, explain it, because he has to leave. Representative Lombardi, you have the floor, please.
Thank you, Mr. Chair, and I'll try and be as quick as possible. This is Bill 5019, which creates a special legislative commission to study and assess the implementation of an improved Medicare-for-all type single-payer program in the state of Rhode Island. And what this resolution does, Mr. Chair, is, and members of the committee, creates a 19-member special legislative commission, and that's all outlined in the legislation, whose purpose it would be to study and assess the implementation of an improved Medicare-for-all type single-payer program in Rhode Island, and who would report back to the Senate and House 1 year from the date of passage, and whose life would expire 2 years from the date of passage. So as you see, it does have a sunshine clause. Representatives Potter and Morales will be speaking at length about it. My understanding is there may be as many as 60 people that will be testifying, and there's been at least 12 to 15 letters. But I think what you really need to do is, unless you were made out of stone, and I know that none of you are, the testimony at one of the Senate hearings on a bill that's kind of similar to this, it was really earth-shattering in some cases. It was tear-jerking, but it was very emotional. And what this does, and it sets out who could possibly be on this commission, and this is about openness, being able to see what people are all about, and about really creating a program where, especially with COVID, and we're seeing it now, it certainly affects those in the less affluent area and people in the minority community, where we need to get them some kind of coverage, because people, literally, well, everyone knows what's going on. I don't have to report that. So unless there are some questions, Mr. Chair, and members of the committee, I want to thank you. I thank you for your patience, and please listen with an open mind. You're going to hear testimonials, that stretch from here to other parts of the world, and it's really earth moving, and it will touch our heart. It really will. Thank you, Mr. Chair, members of the committee.
Thank you, Representative Lombardi. What we're going to do is I'm going to leave the bill open for testimony. We're going to come back to it later. We have some other items to take care of, and as well, I'll have Representatives Potter and Morales do their introduction as well before we get to testimony.
Thank you, Mr. Chair.
Thank you. So right now, we're going to move on to Representative Williams, House Bill 5464. This is the licensing of healthcare facilities. Representative Williams,
Thank you.
go right ahead.
Thank you, Mr. Chair, members of the committee. This act would mandate that a patient shall not be denied appropriate care on the basis of age, sex, gender identity, sexual orientation, race, color, marital status, familial status, disability, religion, national origin, source of income, source of payment, or profession at all. It updates our current statute, which only pertains to race, color, religion, national origin, or source of payment. As we acknowledge how diverse our society truly is, as we acknowledge it, we still got a long way to go. It is becoming increasingly more important that our services are inclusive to all types of individuals in need. These additions in the statute will guarantee that any individual, no matter their differences, will be given the medical care that they rightfully deserve. Thank you.
Thank you, Representative Williams. Chairwoman Williams, I'm sorry. Are there any committee members that have a question for the sponsor at this point? If not, we'll move right on to testimony. Any questions? Thank you, Representative Williams. Chairwoman Williams, we appreciate your time. We're going to go to our first virtual testimony. Hello, this is Representative Casey, Chairman of the House Health and Human Services Committee. Who am I speaking
Yes,
to?
hello. This is Melissa Bruto.
Melissa Bruno, you have the floor. You have our attention. This is House Bill 5464 by Representative
Wonderful.
Williams. Go right ahead.
Yes, thank you so much for considering this important issue, and thank you to the committee and to Chairwoman Williams. Much appreciated. I'm an attorney and an advocate for people in the sex industry, including survivors of human trafficking. And I want to voice my support of this important expansion of ensuring that there is protection for all people against discrimination when it comes to accessing health care, which is a fundamental human rights need that all of us have. And I know, from clients that I've represented that there is so much stigma and fear in accessing supportive, non-judgmental, affordable healthcare services when you are a marginalized individual. So I really applaud the committee and Rhode Island for considering this in having the most supportive Patients' Bill of Rights. Thank you so much for your time.
Thank you very much, Melissa. Are there any questions for Melissa? Okay, we're going to move on to our next caller. Thank you.
Thank you.
Okay. J. Lee Oshiro Brantley. Are you with us?
Yes, thank you.
Hi, this is Representative Casey, Chairman of the Health and Human Services Committee. You are live with us on House Bill 5464. You have our attention. Go right ahead, please.
Thank you so much for allowing me to testify tonight. I'm a transgender sex worker, and if it had not been for COVID-19, I actually would have started my PhD in human sexuality research, focusing on disability and sex work back in September. So this issue is definitely of a, public health nature. Is not just personal, but it's academic interest for me as well. So when medical interventions hit the market, the moral stigma of sex work often leads to sex workers being one of the last marginalized groups to be included in populations that should logically already be included into those medical interventions through the evidence-based research that allowed for them to hit the market in the first place. For instance, in the first few years that the drug PEP, post-exposure prophylaxis for HIV, became available to the public, it was first marketed in advertisements and at doctors' offices and posters as really only a gay men's drug, even though it was approved for everyone. And as sex workers, we rely on safer sex interventions like PrEP and PEP and condoms for harm reduction and to protect ourselves. And when I had to speak to my medical provider about going on PEP after a potential exposure, I was met with resistance. It was first judgment and acting as if I didn't really know what PEP was or who it was for, because clearly I didn't look to them like I was a gay man. So maybe I was confusing it with something else. And then it came hounding, why would I need to be on PEP? And I then felt pressure to disclose my sex work and explain the specifics of the sexual activity and why I needed the medication, even though it had been, again, approved for everyone at the time. So Like any sexually active young adult, why wasn't my disclosure that I may have been exposed to HIV and needed to be prescribed PEP enough for them? Why did my medical providers feel the need to hound me about the specifics of why I needed it? Not only did I have to disclose being transgender, I had to disclose the specifics of the kind of sexual behavior I was engaged in and the professional circumstances under which that behavior happened, i.e. my sex work. I even ran the conversation by another doctor friend of mine afterwards because I felt so bad by the encounter. None of those particulars were medically relevant, he said. It was just a stigma against sex work and against me being transgender. So the discrimination against people like me, who are trans sex workers, is prevalent and still comes up in things like PEP with medical community because there is still this illogical connection of HIV to just gay men. And there is still widespread discrimination against sex workers. And if you add further marginalized identities like being trans or having a disability to that, the stigma and marginalization are further and further compounded. So this is one of many, many times I've been shamed and traumatized by medical professionals over things like my sex work, gender identity, and the kind of queer sex I choose to have. So it's this kind of othering through the medical system for trans and queer people, those of us with disabilities and sex workers, that is so common. Most of us have just integrated it, the discrimination and stigma into our lives. So to do no harm is the oath a doctor takes, and encounters like these are traumatizing. This bill will provide protection against further trauma for communities like mine. Thanks so much.
Okay, thank you very much for your testimony. Are there any questions from the committee? Okay, we're going to move right along to the next person. Hello, Henry?
Hello.
Yes, hello. This is Representative Casey, Chairman of the House Health and Human Services Committee. I have you testifying for House Bill 5464. Please understand, I apologize, but we have many different callers are calling in tonight on many different pieces of legislation. I need you to keep your testimony as brief as possible. Go right ahead.
All right, I can do that. First of all, thank you for coming together and holding an audience with us tonight. My name is Henry Binks. I'm the co-founder and co-director of the ISTAR Collective. Finding a reproductive healthcare professional has always been kind of a sore spot in my life. Even before I began my career as a sex worker, I had many unfortunate encounters with OBGYNs when the discussion came to my sexual affairs. Most women in the 21st century have heard the phrase slut shaming at least once, but this particular brand of silencing takes a whole new venom in the medical industry. I cannot express enough the feelings of violation and shame that have been attached to simple exams, treatments, and regular testing, all as a result of my own desire to conduct myself safely in my work and the unfounded biases of the professionals I put my care in the hands of. The most disturbing part of this, though, is these appointments have taken place across the nation, and that same kind of outward discrimination has been a trend, which has made finding a trustworthy care professional, it's been a very taxing and traumatizing process, to which thus far I've found no end. It is because of these sentiments and these traumatizing experiences that I express 100% support for the bill. And I hope that our audience tonight can see the benefit of providing these protections. Thank you.
Thank you very much, Henry. I appreciate that. Are there any questions from the committee?
Nope. Thank you very much.
Thank you very much. We have a next virtual caller. Hi, this is Representative Casey, Chairman of the Health and Human Services Committee. Who am I speaking to?
Hello, my name is Tricia Navalu.
Hello, Tricia. You have the attention of the committee for House Bill 5464. If you would please keep your testimony as brief as possible. Go right ahead.
Sure. I am in support of Healthcare Bill of Rights 5464. My name is Tricia Navalu. I'm a community organizer with Erotic Laborers Alliance of New England. I am an active sex worker with 20 years experience engaging in multifaceted roles, mostly as a performer in the adult entertainment industry. My personal experience of shame, stigma, and discrimination comes from visits to both my OBGYN and my primary care physician. I was at an annual physical exam when I disclosed to my doctor that I was a pornographic actress, and her response to me was shocking. She said that it was a poor career choice with high risk of STIs. I then had to educate my doctor on the rigid testing protocols in the adult entertainment industry. My doctor said that the pain that I was experiencing at the time must have come from an onset injury, and I really should just find other more respectable work. Turns out my injury was unrelated to my profession. The following annual physical examination with the same doctor resulted in another stigmatized, shame-filled experience. Although I was not denied health care, I was made to feel bad about my career choices. My doctor said to me, "I hope you're not still doing porno movies," and that she could not believe that my husband of 12 years would allow me to engage in that type of work. She asked me when I was planning to settle down and start a family. Because of this discourse and shame from my doctor, I was hesitant to seek further medical care, even when I needed it. Then, during a routine pap smear at my OBGYN, they informed me I had a mild yeast infection and that this is what I should expect when doing porn for a living. After I informed my OBGYN that I had not performed in any movies for 6 weeks, they told me that it was not likely that a performer in pornography could ever possibly have a healthy vagina or maintain a healthy pH balance. That was a statement of opinion, not based in medical science. My OBGYN then offered their unsolicited opinion of exploitation in adult entertainment. They assumed I was being coerced, forced, or otherwise trafficked into my decision to perform in pornography. This discourse is not uncommon. The shame and stigma that those who engage in sex trade face when seeking medical care prevents proper medical care for so many in our community. Thank you so much for your time today.
Thank you, Tricia. We appreciate your testimony. Are there any questions from the committee? Seeing none, we're going to move right on. Thank you again.
Thank you. Have a good one.
Hello, Crystal?
Yes.
Hi, Crystal. This is Representative Casey, Chairman of the House Health and Human Services Committee. We have you before us for House Bill 5464. If you would please keep your testimony as brief as possible. You have our attention. Go right ahead.
Yes, hello. Thank you so much for having me here tonight. I'm calling in favor of the bill to expand health care Bill of Rights to include groups of people who have historically experienced obstacles to health care. Specifically, the group I'm concerned with are people who work in the sex industry. I'm a healthcare provider who's been providing services to this industry, people who've been involved in this industry for over 20 years, regardless of whether they are in the industry by choice, circumstance, or coercion. And I wanted to talk briefly about the two ways sex workers have explained to me that they're kept out of healthcare, implicit bias and explicit bias. And some of the speakers that I've just heard have described some of this, so I'll keep it brief. And I also just want to talk briefly about why I think this bill will make a significant impact in their lives. So implicit bias includes framing healthcare in a way that judges, makes uncomfortable, or ignores the realities of people's lives. And this comes in the form of, for example, questions that indicate that numerous sexual partners are bad or risky. For example, a healthcare provider might say, "How many partners have you had since your last visit?" When instead that question would be, could be framed so much better as, "Have you had consistent access to condoms and other needs in your sex life?" These and other changes could be promoted by this kind of change in the law. There are numerous examples of how these kinds of traditions play out in different health environments. And so the other type of bias I'd like to talk about briefly is explicit bias. And this includes rash actions like calling the police to save a consensual adult sex worker who ends up getting arrested or later harassed by the police. Another action I've heard about numerous times is actually turning a sex worker away or telling her her choices are too risky to bother the health workers with constantly providing her with care. In cases of real or imagined human trafficking, something that I like to think of as hero mentality often results in pushing a patient into situations she isn't safe or ready for. There are many ways that people in the adult industries have experienced obstacles to health care. This expansion would send a message to sex workers and other workers in non-traditional industries that they have a right to health care. It would arm community activists with a tool to call for equal care. And lastly, it would provide NGOs with information to request change in the form of educating the healthcare industry about these often well-meaning obstacles that are historic in nature and largely unexamined. And I'll leave my testimony there. Thank you so much for your time and attention.
Thank you very much, Crystal. Are there any questions for Crystal, please? Seeing none, we'll move on to our next testimony. Hello, Wendy. This is Representative Casey, Chairman of the Health and Human Services Committee. How are you today?
Fine, thank you very much.
Okay, Wendy, we have, if you can just keep your testimony brief, we have a lot of people to get through this evening on a multitude of bills. Go right ahead.
Okay, thank you, Chair. And members of the committee, I appreciate your time. I'm testifying in support of this bill for LGBTQ Action RI, an advocacy organization dedicated to securing equality and justice irrespective of sexual orientation or gender ID. This bill affirms the dignity of all Rhode Islanders seeking health care, extending rights to protect classes not currently covered. We thank Chair Williams for her sponsorship. Seeking health care can be a vulnerable situation for anyone. For LGBTQ Rhode Islanders, it comes with a fear that we may experience prejudice and discrimination on the part of healthcare providers, causing some people to delay or neglect necessary medical or behavioral health care. In fact, for the last 4 years, the federal administration worked hard to ensure healthcare providers could discriminate against LGBT people if they believed it conflicted with their religious beliefs or morality. Well, that's not the policy now. It would be reassuring to have these health care protections enshrined in state law. In an emergency or during preventative health care, no one should feel that they'll be denied care or receive discriminatory treatment due to sexual orientation, gender ID or expression, or for any other class this bill includes. LGBT Action urges the committee to pass the bill. Thank you very much for your time.
Thank you very much for your testimony. Are there any questions from the committee? Okay. We're going to move on to our next testimony. I believe we have Dr. Nunn. Hello, Dr. Nunn. Hello, Dr. Nunn. This is Representative Casey, Chairman of the Health and Human Services Committee. We're glad you can join us tonight. You're here for House Bill 5464. If you would keep your testimony brief, that would be great. Go right ahead, please.
Good evening. My name is Amy Nunn. I am Executive Director of the Rhode Island Public Health Institute and Open Door Health. Open Door Health is an LGBTQ clinic on the west side of Providence. I'm also a professor of public health and medicine at Brown University, and I hold master's and doctoral degrees from the Harvard School of Public Health. I want to testify in support of this anti-discrimination bill. We are an LGBTQ clinic that newly opened last year on the west side of Providence. We are the first and only LGBTQ clinic in the state of Rhode Island. This bill extends a lot of civil rights protections beyond just the traditional ones in ways that I think are very important for many of the people that we serve and many of our patients. People are often discriminated against for many different things, including not just the traditional things that we think about, but also gender expression, and also a lot of things that have to do with how people express their sexuality. And I think that often presents a huge barrier to care. Many of the patients that we serve, in fact, feel that they have been traumatized by the healthcare system because they've been discriminated against, not just by providers, but also other support staff in clinical settings. And I think that this bill will go a long way to prevent people from discriminating against people who are often most vulnerable for a lot of both chronic and infectious diseases. The LGBTQ community disproportionately is impacted by many different diseases, and including chronic disease, infectious disease, and mental health. And a lot of people fear going to the doctor because they feel that they do not have a safe harbor. We have tried to create that safe harbor at Open Door Health, but find that we are often paying for the sins of our predecessors. And we do everything possible to make our clinic a warm and welcoming and affirming environment. And I think institutionalizing a lot of the things that we already do in our clinical practice would go a long way to advance the health needs of a lot of the people that we serve. I'm happy to take any questions.
Thank you very much, Dr. Nunn. Does anybody have any questions? Okay, hearing none, we're going to move to our next testimony. Thank you very much.
Thank you.
Well, hello, Randall Rose. This is Representative Casey at the Health and Human Services Committee. You are here on House Bill 5464. If you would please keep your testimony under 2 minutes, we would appreciate it. Go right ahead, sir.
Thank you, sir. I do support the idea behind this bill. I do have some concerns about the wording. I think it could be phrased a little better. The bill lists some factors that cannot be used for discrimination, cannot be used to deny appropriate care. There are situations where doctors will use a factor like age to decide what kind of care to give. For example, a 90-year-old might not be offered certain kind of surgeries or transplants, maybe because a 90-year-old's body isn't strong enough to handle those kinds of surgeries or transplants. So there are legitimate cases where you want to treat people differently based on age. There are no legitimate cases where you want to where a doctor should treat somebody differently based on gender identity or sexual orientation. So I realize the bill says that that you can't deny appropriate care based on age. Although that word "appropriate" is a little vague, doesn't make clear what's appropriate. But what I would suggest is that the bill should say that nobody should be denied any care, not just appropriate care. Nobody should be denied any care based on gender identity, sexual orientation, marital or familial status, source of income, profession, and the other factors that were already in the law. And I would prefer also if the bill spelled out a little bit more about what's appropriate care in terms of somebody's age or disability status, or sex, or maybe race. I think it would be I think it's good to spell out that appropriate care doesn't mean that you value an intellectually disabled person's life less. It should be made clear that care should be based on the idea that everybody's life has the same value, and that everyone is equally deserving of treatment that will improve their quality of life. So those are a couple suggestions, but as the bill stands, I don't think it's bad. It won't do harm, but because it just doesn't spell out what appropriate care is, so it may leave a little too much of the existing bill may leave too much of a loophole for doctors to inappropriately treat people differently based on their ideas of what's appropriate. So I'd prefer some clarifications, but the bill is not bad as it stands. Thank you.
Thank you, Randall. Thank you for your testimony. Are there any questions for Randall? Thank you, Randall. What I would suggest, if you have language that you think may make this better, you feel free to send that forward to me at my State House address. Okay? All right. Do we have any other virtual testimony? Okay. Was there a Wendy Becker, or did I just forget to cross her off? Okay. Thank you. Are there any questions? Any comments from the committee? Great. We are going to close the hearing on House Bill 5464. Thank you, Representative Williams. I'm going to quickly move on to Representative Fogarty's bill. If you can just get yourself situated through there. I believe it's 5544, Representative Fogarty. There is no virtual testimony, nor is there any written testimony. Representative Fogarty has to go and chair another meeting. Please go ahead, Representative Fogarty. 5544, the floor is yours.
Thank you, Chairman. House Bill 544 is an act that would include the definition change in the general laws of unprofessional conduct performing a pelvic examination without consent of an anesthetized or unconscious female patient. This happened to a friend of mine who is actually in who didn't want to come to testify and still does not, but was in a situation where she was having a procedure, but it was a school with medical students, and she did not realize that there was going to be so many medical students who would also be involved with the type of a pelvic examination, along with just her regular doctor, which I thought was, they got consent for the regular doctor, but the students, it just did not seem right. So I think that's unprofessional conduct, that people should be able to know what's going to happen to them. Most doctors do this the right way, but this is just putting that in there, that this would change the definition of unprofessional conduct in the Rhode Island general laws for anybody that decides to do a pelvic exam without getting the consent or having any type of students either come in and do a pelvic exam on a woman. So again, and it also, if anybody is put under at any other type of a physician's office, and this type of an examination happens, and it shouldn't. I know there was a story too that happened a few years ago, actually probably about 20 years ago now, in Warwick with an ear, nose, and throat doctor. So again, this is just a basic changing of the general laws to put this in the definition of unprofessional conduct. That's all. Thank you.
Thank you, Chairwoman Fogarty. Are there any questions regarding this bill for Chairwoman Fogarty? Seeing none, I will close the hearing on this bill, and we are going to move on. Let's see right now. Representative Edwards is going to be next. Representative Edwards, House Bill 5460, relating to health and safety regarding sexual assault evidence kits. Representative Edwards, are you with us?
Yes, I am, Chairman. Thank you.
Go right ahead, sir. You have the floor.
Thank you, Chairman. This bill basically codifies what Rhode Island Department of Health believes they are already doing. So I'm going to just get right into it. This bill would require that an inventory of all kits and provide a count of all the untested kits that are currently in state possession. The number of kits would be the number of kits that are destroyed every year, and would require the reasons for the destruction. It would require mandatory submission of any new kits after the passage and enactment of the legislation within 24 hours of collection to law enforcement. It would also require a tracking system for these kits to be developed statewide, and it'll be an electronic system that the state could easily track and find out the status and location of any kit at any time. It would also create a victim's rights of notice. I'm going to let some of the people who are going to testify speak further to those. One thing you want to bear in mind, rape is a horrendous crime, brutal, and people have to live with it as victims for the rest of their lives. A survivor who goes through the 4 to 6 hour procedure that basically treats their body as a crime scene need to have their kits, you need to have that crime scene protected. The kit is the evidence. They need to have that kit preserved, protected, and when appropriate, have the kit tested and brought into evidence. 3/4 of all cases are not reported right now. So we're talking about huge amount of unreported crimes. I know you all received a letter from the Rhode Island Department of Health. They submitted a letter saying basically that they are doing all of the things required in this legislation. That's great. This bill only codifies what they're already doing. So it makes sure that future administrations will be equally bound to follow these procedures. As we've just seen, one administration can change an awful lot. And sometimes, and most times, not for the better. Thank you, Chairman.
Thank you, Floor Manager Edwards. Are there any questions from the committee at this time for Floor Manager Edwards? Hearing none, we will move on. Chris, if you would, in this order, please call the person on line 7 first.
Casimiro,
Hello, Ms. Necht.
it's on the list.
Hello, this is Representative Casey, Chairman of the Health and Human Services Committee. Who am I speaking
There was
to?
one that got removed.
Oh, hello.
Yes.
I'm so sorry. Hi.
Yes, could you please introduce yourself to the committee?
Absolutely. This is Ilsa Connect. I am the Policy and Advocacy Director for the Joyful Heart Foundation.
Okay, Ilse, you have the floor on House Bill 5460. Representative Edwards gave a great introduction to this bill. If you would, please keep your testimony brief, but go right ahead. You have our attention.
Great. Thank you so much. Good evening. My name is Ilsa Connect, and I'm the Policy and Advocacy Director for the Joyful Heart Foundation, founded in 2004 by Law and Order SPU actress and advocate Mariska Hargitay. Since 2010, I've made eliminating the nation's backlog of untested rape kits our top priority. I'm very grateful for the chance to testify in support of House Bill 5460, and we have submitted written testimony as well. Our 6-pillar approach to rape kit reform, outlined in my written testimony, has become the national standard for reform. 43 states have passed at least one pillar. 12 states have enacted all 6. Rhode Island has not enacted any. This bill will change that by enacting 5 at once. And if this bill is funded, Rhode Island will become the first state in the nation to pass all 6 pillars in one session. So thank you so much to Leader Edwards for bringing this bill. Committee members, what is crucial for you to know is when rape kits are tested, the DNA in them can identify unknown offenders and link crimes together, revealing serial rapists. And behind each one of these kits is a survivor whose body has become a living, breathing crime scene. When kits are not tested, the results are catastrophic, as dangerous offenders are left on the streets to harm over again. And they do. Research out of Ohio, Michigan, and West Virginia show that serial rapists are more common than previously believed. Even more, offenders who commit sexual assault are often engaged in other crimes such as burglary, domestic violence, child abuse, and homicide. We don't know right now how many untested rape kits are sitting on Rhode Island law enforcement and hospital shelves, but we do know that a Target 12 report found that only 30% of rape kits are tested routinely in Rhode Island. The inventory in this bill will help uncover any untested kits across the state, no matter where they are. This bill will mandate the testing and tracking of newly collected kits in a timely manner, the only way to bring transparency and accountability to the system and justice to survivors. In addition, perhaps most importantly, HB 5460 grants survivors the right to know the status of their rape kit, which is central to their healing. As was uncovered last year, survivors in Rhode Island face a complicated web when trying to get information about their rape kits. This bill would solve that issue through the right to know the status of their kit and by creating a tracking system with a victim portal to allow them to check on their kit at their convenience. They should not have to struggle to get this information. This is a monumental bill that would align Rhode Island with national best practices and codify sustainable and effective rape kit handling processes that will withstand leadership changes and shifting priorities, and send a message to survivors that what happened to them matters. Thank you so much for your time.
Thank you very much for your testimony. Are there any questions from the committee at this time? Hearing none, we'll move on. Thank you so much.
Thank you.
Hillary? Hello, Hillary Friedman.
Yes.
Yes, this is Representative Casey. Welcome to the Health and Human Services Committee. You have our attention. You have our attention for House Bill 5460. Representative Edwards has given a great synopsis of the bill. If you would, please keep your testimony brief. We would appreciate it. Go right ahead.
Thank you so much. Yes, I'm Hillary Levy-Friedman. I'm president of the Rhode Island chapter of the National Organization for Women, and Rhode Island now strongly supports Bill 5460. As you know, it establishes a statewide database to help track untested sexual assault evidence kits. And the backlog of sexual assault evidence kits is a national problem, and the state needs to do its part. So passing the Sexual Assault Evidence Kits Act is a crucial first step because it's a problem that has not previously been addressed in the state. And moreover, Rhode Island is one of only a handful of states that doesn't test all sexual assault evidence kits, and it also has no idea how many untested kits exist. So this important legislation would change that. So why should we test all of these kits? And I have 3 reasons. The first is public safety. Obviously, testing sexual assault evidence kits can identify offenders who commit sexual assault, but additionally, it can help connect dots to other crimes like domestic violence, homicide, burglary, and assault. And we can catch perpetrators and also potentially exonerate those wrongly convicted. We also can see a positive economic impact. So put simply, testing can help prevent future crimes. According to a study out of Case Western Reserve University, testing just 4,300 previously unsubmitted kits in Cleveland saved $38.7 million, or just under $9,000 per tested sexual assault kit. And those savings come from following up on DNA testing results with thorough investigations and prosecutions. In other words, by getting offenders off the street, we're thereby preventing future rapes and other crimes. Finally, we must center victims of sexual assaults. By not testing these kits, let alone even keeping track of how many of them there are, the implication is that these crimes are not serious enough to warrant attention. This, to me, sends an inexcusable message to survivors that they do not matter and what happened to them does not matter. So we must do better, and I please ask the committee to move this act out of the committee into a floor vote.
Thank you for your testimony. Are there any questions from for Hillary, please, from the committee? Seeing none, we'll move on. Thank you very much, Hillary.
Thank you.
Emma actually got disconnected, so I'm going to give you Kelsey, and I'll call Emma back.
Hello, Kelsey? Hello, Kelsey? Emma? Kelsey? Who do I got? Try Emma back first, please. While we're waiting to connect, is there any testimony or commentary from the committee?
I lost you, but now we're ready for it.
Hello, Emma?
Hello.
Hi, Emma. This is Representative Casey, Chairman of the Health and Human Services Committee. I have you before us on House Bill 5460 by Representative Edwards. If you would please keep your testimony as brief as possible, we would appreciate it, and go right ahead.
Sure, thank you. So my name is Emma Gothier, and I am coming to you today as a Women's Policy Institute Fellow and an advocate for sexual assault survivors, and I urge you and the committee to pass this bill to the floor. I would like to take a moment to just briefly introduce you to the Sexual Assault Evidence Collection Kit, or the RAPE Kit. The entire kit is 17 different steps that include collecting the survivor's clothing, genital swabs, fingernail scrapings, oral swabs, and photographing the survivor's body for physical signs of assault. It is a process that can take several hours to complete, and it's an intense, uncomfortable, invasive process that sexual assault survivors must go through at one of the most vulnerable points in their lives. Survivors go through this process because it's the only way to tie credible forensic evidence to their case. As it stands, survivors must choose to press charges in order for their kit to be tested. If a survivor chooses to press charges, it can take months to years for their kit to be tested and their case to be tried. Many survivors choose not to press charges because they know that on average, less than 1% of rapists end up in prison for their crimes. They too deserve to have their kits tested to validate their experiences and provide them with much needed closure after a horrific, traumatic experience. As an advocate for sexual assault survivors, I've held the hands of women as they've undergone this process, and I have heard their stories. Each kit waiting to be tested in the rape kit backlog represents a human being worthy of justice and respect. In the United States, we ask so much of sexual assault survivors seeking justice. What were you wearing? How many drinks did you have? Where is the evidence? In many cases, we have the evidence, and the evidence is sitting in storage in police stations across our state. The Rape Abuse Incest National Network calls the rape kit backlog one of the biggest obstacles to prosecuting perpetrators of sexual violence. Passing H 5460 is a critical step in taking sexual assault cases seriously, protecting survivors, and holding offenders accountable. Please pass this bill. Thank you.
Thank you very much for your testimony, Emma. Are there any questions for the committee or from the committee, please? Seeing none, we will move on to Kelsey Edwards. Thank you, Emma. Hello, Ms. Edwards.
Yes. Hi.
Yes, this is Representative Casey, Chairman of the Health and Human Services Committee. I have you online here to testify on House Bill 5460. You have our attention and the floor. Please go right ahead.
Thank you. My name is Kelsey Edwards, and I'm calling to voice my support for House Bill 5460. We can spend 5 minutes on Amazon, order something, and know exactly what happened from the moment of purchase until the moment of delivery. We can even get a picture of where our package was left. We can follow products and objects and be kept in the loop of the location of things like vitamins or books. And yet, when someone becomes a victim of a terrible crime, we have no way for them to track the evidence that they provided. We have no way for them to track the status of their case. We only tell them that things will be handled and they'll get justice, and we leave it at that. Rape kits are evidence, but they are lives. Each kit holds evidence to a painful chapter in someone's life. It represents 4 to 6 hours of intensive and invasive examination that someone underwent because they were told that it was the first step to getting justice. And yet, when a victim becomes evidence and takes that first step toward being a survivor, they are not told that that next step may never actually come. Across the country, the backlog of rape kits is a significant problem, and it can be very easy to assume that here in Rhode Island, things are somehow different. 43 states and D.C. have tackled this problem with at least one piece of legislation. Several states, including Massachusetts and even Texas, have enacted some of the most comprehensive legislation to end the backlog, and yet Rhode Island has not even addressed the rights of survivors in the wake of what is almost certainly the worst day of their lives. 1 in 8 Rhode Island women have survived a sexual assault at some point in their life, and as a state, we have repeatedly failed them. As a society, we regularly condemn sexual violence, and yet only 3% of rapists are incarcerated for their crime. So it's time to put our anger into action. Survivors have had their voices silenced, and as someone who has been affected by sexual violence, I can assure you that the pain that comes with a lack of justice runs deep and is long-lasting. We have had our voices silenced, and that silence is deafening. Rhode Island has failed us, but we can take a step toward changing that, and this bill is that step. Please help our voices be heard. Help us to get justice. Please support this vital piece of legislation. Thank you.
Thank you, Kelsey. We appreciate your testimony. Are there any questions for Kelsey from the committee? All right. Are there any other comments from the committee regarding House Bill 5460? Hearing none, I will close that hearing. House Bill 5460 is now closed. Representative Carson, are you with us?
I sure am. Thank you, Chairman.
Okay, hold on one second. If I can just get your bill number again, I'm going to take you because you only have 1 or 2 people to testify. I'm sorry?
5373.
Okay, House Bill 5373 by Representative Carson. If you would like to go ahead and introduce it, and we will take the testimony. Go right ahead, please.
Thank you very much. I first became interested in policy around cemeteries about 18 months ago when I was approached by members of the Rhode Island Historical Cemeteries Commission about really the variety of issues that exist in our cemeteries across the state. And I think that before I discuss the bill, I want to make a few statements. There's different kinds of cemeteries out there. There are historic cemeteries that are no longer used. There are historic cemeteries that are still used. There are private cemeteries that are still used. And there's a variety of problems that exist on them. There's vandalism. There's municipal management of some of them. There's the historical aspect of some of them. And when I dug into it, I really learned a whole lot about it. And there's over 1,300 historic cemeteries in the state. And when I dug in, there's really a lot to know about this. But in this bill, I honed in specifically on one aspect of active cemeteries. They could be historic and active, but they're not historic and not being used anymore. And that is that under current state statute, if a Rhode Island resident buys a plot in a cemetery, 20% of the purchase price of the plot goes into a perpetual fund that the cemetery management is to use to maintain the cemetery. So like I'm only about 40 years old and I buy a plot in a cemetery and I want it to be intact by the time I die, which I could be 80 at that time. And so these perpetual funds are supposed to be used to maintain the cemetery so that when the day comes that I need to use the cemetery, unfortunately, it's going to be in good shape, it's going to be clean, it's going to be maintained, it's going to be free of debris, it's going to be free of vandalism. But there have been cases around the state where there's been some questions about these perpetual funds and whether or not they're really going into the maintenance of cemeteries. There have been situations in Newport where there have been questions about that in our active cemeteries. And there's also a fairly infamous actually, cemetery in Cranston where the money has not really been put back into the cemetery. And so the folks that are alive and have bought these plots in these cemeteries, they're asking questions about how these perpetual funds are used. And so after studying the cemeteries for a while the past 18 months, I sort of chipped off this little piece of cemetery issues and policies, and that is to really require that the perpetual use of the perpetual funds be filed with the Attorney General's office, so that either a current owner of a plot or a prospective owner of a plot can really understand how the perpetual funds are used. And we're asking these cemeteries that are ongoing to file these reports once a year, to put the name of the person that manages their money, to explain how they use the perpetual funds, so that there can be a reassurance for the plot owners as well as the prospective plot owners as to the fact that there is really money going into maintaining these cemeteries. So it's a fairly simple bill. It sort of chips off one aspect of cemetery management, and I think it opens up a conversation for us both in this committee as well as in the House about both historic and active cemeteries.
Thank you, Representative Carson. Are there any questions from the committee at this time for Representative Carson? Hearing none, we will go to our virtual testimony, please. While we are getting our person for virtual testimony, I will let you know that there is also written testimony on this bill from Margaret Malcolm, who is in favor, Walter Slocum from Cranston Historical Society, who is in favor, the Cemetery Commission, Rhode Island Commission for Human Rights as well, are both in favor. Louis Keene, do I have you on the phone right now?
Yes, you do.
Hello, Louis. This is Representative Casey, Chairman of the Health and Human Services Committee. You are on the line with us to testify on House Bill 5373 from Representative Carson regarding the cemetery perpetual funds reporting. If you would please keep your testimony brief. Go ahead. You are on the air.
Thank you very much for this opportunity. As a member of the Rhode Island Historic Cemetery Commission and also the Newport Historic Cemetery Advisory Commission, I can attest to the fact that we've had individuals over the years contact us to ask what's going on in certain cemeteries with regard to perpetual care. While the state regulates the funds and how they are spent and where they are placed, there's absolutely nothing in place for accountability. And we've been unable to help people looking for answers. This bill will provide some measure of accountability for the spending of those funds. And that's why I speak in support of it.
Thank you very much. Are there any questions for our virtual guest? All right. Are there any comments or questions from the committee? Representative Carson, any closing comments for you?
No, thank you, Chairman. Thank you for your time.
Thank you very much. That will close the hearing on House Bill 5373. If everybody could just stand by for a moment. I've got quite a few little things in front of me here. All right. Hold. All right, give me one of the shorties. Thank you. We're going to take House Bill 5431 on your calendar. Actually, no, we're going to hold that. That's going to be held. Can I have the next one, please? Okay. Can you... Okay, everybody, thank you for your patience. I have House Bill 5461. This is also by Representative Edwards. We're going to have one virtual testimony. This is entitled regarding accident and sickness insurance policy. Representative Edwards, would you like to introduce this bill, please? He may be in another committee, although I do see his name here. I'll just give you a brief synopsis. This bill would require that a participant or beneficiary incur no greater out-of-pocket expense for an emergency services than they would have incurred with an in-network provider other than in-network cost sharing. We have one person for virtual testimony. If everyone would just stand by for a moment. We're trying to juggle a few things here so we can take care of business. What have you there? Okay.
Come on, Alan. 5461.
Hello, Ms. Tomaso.
Yes, Chairman.
Yes, this is Chairman Casey of the Health and Human Services Committee. I have you here on House Bill 5461 by Representative Edwards. Representative Edwards is indisposed at the moment, so if you would give us a little synopsis of the bill, and your testimony would be great.
Sure, Chairman. Thank you very much, members of the committee. My name is Lisa Tomaso. I am the Vice President of Strategy and Public Relations for the Hospital Association of Rhode Island. And certainly the Hospital Association appreciates Floor Manager Edwards' leadership on this very important issue. We know that it is a piece of legislation that has that the legislature has struggled with over the last several years. I know that we've been involved in a number of conversations with a number of representatives who have taken leadership on this particular issue. And Harry strongly supports protecting patients' rights from surprise medical bills, which is what Representative Edwards' bill does. But last December, Congress passed, approximately the end of December, Congress passed the No Surprises Act as part of the Consolidated Appropriations Act. The No Surprises Act establishes patient protections against surprise bills and includes several transparency and other provisions that would be important for consumers as well as providers and insurers. The No Surprises Act has begun its regulatory process and is expected to be put into effect on January 1st of 2022. And for that reason, Harry respectfully requests waiting for implementation of the No Surprises Act before moving forward with state legislation relating to surprise billing. Thank you for providing me the opportunity to speak, and if you have any questions, I'd be happy to answer them.
Thank you so much, Ms. Tomaso. Are there any questions from the committee at this time regarding House Bill 5461? Hearing none. Thank you, Ms. Tomaso. We will go ahead and move on to our next bill.
Thank you.
Thank you. This closes the hearing on 5461. Let's see. What do you got there? Yep. Okay, that's okay. Next, we have House Bill 5549. House Bill 5549 by Representative Casimiro regarding licensing of healthcare facilities. It says this act would prohibit licensed healthcare facilities from reusing personal protective equipment. That almost seems self-explanatory. However, we're going to hear the bill. We have Scott Fraser from the Rhode Island Healthcare Association. Hello. Hello, Mr. Fraser.
Yes, Mr. Chairman.
How you doing, sir? This is Chairman Casey at the Health and Human Services Committee. I have you here to testify on House Bill 5549. If you just bear with me for one moment, I'm going to actually read the change in language that will take place if this bill is to pass. It's regarding the extended use of personal protective equipment. It says that no healthcare facility licensed pursuant to this chapter shall permit the extended use or reuse of personal protective equipment designed to minimize exposure to infection or illness. The director is hereby authorized to establish through rules and regulations standards as to what is normal use and what constitutes extended use. You are the only person here to testify, so I will grant you some leeway with time if you would go ahead and explain your position on this bill. Thank you, sir. Go right ahead.
Thank you, Mr. Chairman, members of the committee. I appreciate the extra time, but I will be brief. My name is Scott Fraser. I'm president and CEO of the Rhode Island Healthcare Association, and we represent 63 of the nursing homes in the state of Rhode Island. We are opposed to this legislation on behalf of our members, and in theory, this is a very good and practical idea, and it doesn't sound like anyone would be opposed to it. However, my concern is that actual practice may differ. As we saw in the past year when there was a worldwide shortage of PPE and a declared state of emergency, it became necessary to use personal protective equipment more than once. And when that happened, both the National CDC, Centers for Disease Control, and Rhode Island Department of Health developed guidelines for how to care for and store PPE for multiple use. My concern is that if this law passes and we face another emergency, along with an international shortage of PPE, it would mean that staff would wear no personal protective equipment if they had to use it once, throw it away, and didn't have anything more at their disposal. And obviously that would be harmful to both residents and staff alike. So that is the extent of our concern with this bill.
Thank you, Mr. Fraser. Are there any questions? I see Representative...
Chairman Casey, this is Representative Casimiro. I'm on the line.
Yes, would you like to go ahead and speak to your bill, please?
I would.
Go right ahead.
I just want to point out that on February 16th, there was a story done by Channel 6 News about N95 masks. And hospitals are still rationing N95 masks while manufacturers are stockpiling these. And so much so that these masks are being sold to other countries. And that was the basis of this legislation, that we do have a surplus of N95 masks, and we shouldn't be reusing them for weeks at a time. So that was the genesis of this piece of legislation.
Thank you, Representative Casimiro. Are there any questions for Mr. Fraser? Are you still on the line as well?
Yes, I am.
Okay. Are there any questions for either Rep. Casimiro or Mr. Fraser regarding this bill? Okay, thank you both very much. We are going to move on to our next bill. That closes the hearing on House Bill 5549. And let's see where's next. Okay, stand by for one moment, everybody. Okay, next we're going to move on to House Bill 5546 for Representative Craven. I did send him a message. It's possible that he will come in. This House bill is regarding insurance coverage for mental illness and substance abuse. In a brief synopsis, this act would increase the reimbursement rates for behavioral health providers over a 5-year period. The minimum increase per year would be 4% for a total increase of 23.4% over the 5-year period. This act would take effect on passage. We have written testimony in favor from the Barrington Behavioral Health, also from Stephen J. Scheinkopf, PhD, Brown University, and also from Dr. Judith Scarpfin, psychologist. We have 2 people for virtual testimony. Chris, if you will let me know when we have someone on the line.
Lori's on line 1.
Hello, Laurie. Hello, Laurie.
Yes, this is she.
Laurie, if you would introduce yourself to the committee and go ahead and testify on House Bill 5546, you have our attention. Go right ahead, please.
Well, thank you so much. I really appreciate this opportunity, and I also want to extend my gratitude to Representative Craven for submitting this legislation. It's really important to the mental health community. 1 in 5 Rhode Islanders lives with a diagnosable mental illness, and since the pandemic began, rates of anxiety and depression have skyrocketed. Rhode Island's public and commercial insurance networks lack enough outpatient therapists, psychologists, and psychiatrists to meet the demands of our population. And consumers like me have to choose among going on long wait lists to see a psychiatrist, paying out of pocket to go out of network, or foregoing treatment altogether. And you may be asking yourselves, why is this happening? If you go to the Department of Health's website, you'll see that we have a number of licensed outpatient providers in mental health in Rhode Island. But the reality is that many providers, especially psychiatrists, are no longer participating in insurance networks. And that's because public and private insurers do not reimburse behavioral health providers at a rate on par with medical providers as required by the Parity Act, the Mental Health Parity and Addiction Equity Act. In fact, in Rhode Island, studies show that behavioral health professionals receive over 23% less than other specialists for similar billing codes for the evaluation and management of conditions. While primary care doctors can prescribe psychotropic medications, they are not experts in mental illness or psychotropic medications. People with severe mental illness or more than one mental illness deserve to be seen by a psychiatrist, just as a patient with a heart condition deserves to be seen by a cardiologist, not a primary care doctor. I can predict that insurers will claim that higher reimbursement rates and higher utilization rates will result in higher premiums. But actually, studies show that increasing access to treatment at the outpatient level saves money in the long run, because preventing mental health conditions from escalating into a crisis means that consumers like me are not utilizing emergency room departments, inpatient hospitalization, and residential treatment. These are very costly levels of care, and we can avoid them if we can increase access to treatment and services at the outpatient level. So I want to thank you for your time this evening. I'm happy to answer any questions, and I appreciate your consideration and urge you to support this important legislation. Thank you.
Okay, thank you very much for your testimony. I appreciate that. Are there any questions for our witness at this time? Okay, if not, we'll move on to our next witness, which would be Lisa Tomaso. Hello, Lisa?
Yeah?
Yes, this is Representative Casey. Again, we have you back before the committee for House Bill 5546 by Representative Craven. If you would, go right ahead.
Hi, Chairman. Sorry about that. I had my volume on and I was in the wrong place.
Not a problem at all. Everything's good.
Okay. Chairman, I thank you for this opportunity to speak tonight. The Hospital Association does appreciate the opportunity to testify tonight on H5546.
an act that increases all payer reimbursements for behavioral health care providers over 5 years. And we really do applaud Chairman Craven's leadership on this issue. Well, reimbursement rates for Rhode Island behavioral health care providers is well documented, not only anecdotally through some of the testimony that you have before you tonight and stories that you've heard from your constituents and community for providers, but through a number of recent reports, including a February 2020 Behavioral Health Comparison Rate Development Milliman report that was commissioned by EOHHS that related to the development of comparison rates for certain behavioral health Medicaid services provided on a fee-for-service basis, and a November 2019 Milliman research report commissioned by the Mental Health Treatment and Research Institute, which analyzed PPO health plans state by state for disparities in out-of-network utilization rates for behavioral health care compared to physical health services and disparities in provider reimbursement rates for behavioral health care providers compared to primary care and specialty physician health providers for office-based services. As a representative of hospitals and healthcare systems, I would just like to speak briefly to you about the impact low behavioral health care reimbursement rates have on healthcare. Low reimbursement rates challenge the sustainability of our state's healthcare system to deliver the level of care people need when they need it and contribute to the reduced access to care, forcing families and individuals to wait to seek treatment until they cannot manage their health on their own. And it is at this point that many patients present at the emergency departments of an acute care or psychiatric hospital requiring a much higher and more costly level of care. Low reimbursements restrict access to care in the community, compromising the ability of the healthcare system to be able to manage a patient's continuum of care. And by that, what I am referring to is that if a patient finds themselves at a hospital level of care, we would expect that they would be able to step down to the next level of treatment that would be appropriate for them at that level, that they should not have to maintain a hospital level of care. Without proper reimbursement, those step-down levels for behavioral health treatment are not available in the community and therefore create a backlog within our hospital system, causing patients to have to hold on to longer stays at the hospital, but also preventing other patients who may need hospital level of care from being able to enter the system in a timely manner and receive the care that they need to expedite their recovery. So in closing, I would just like to say that investments in behavioral health reimbursement will strengthen the healthcare system, save money, and produce better outcomes for patients. Again, I appreciate this opportunity to speak, and I'm happy to answer any questions.
Thank you so much, Ms. Tomaso. Are there any questions from the committee at this time? Okay, and I have read off who was in support of the bill for written testimony, so at this point we will close the hearing on 5546. Okay, next we are going to take, hold on one moment. We're going to take House Bill 5547. That is by Representative Nardone. Representative Nardone, if you could take the time and take your seat. I will let you know that there is two bits of written testimony for 5547, one from Leading Age Rhode Island, who is against the bill, one from the Alliance for Safe Communities, Ms. Carolyn Medeiros, who is in favor of the bill. Rep. Nardone, if you are ready, Rebecca, if you wouldn't mind, if Rep. Nardone could take that seat, that would be great. Rep. Nardone, I'll give you a few seconds to get yourself situated, and you will have the floor on House Bill 5547 regarding patient visitation rights.
Thank you, Mr. Chairman. First, I just want to go over a little bit on why I brought this bill to the forefront. One of my constituents who had a daughter who was in a nursing home who had a stroke, she was unable to see her daughter for approximately 3 weeks. At that time, they didn't have WebEx. They didn't have anything set up for her to see her daughter. And this was instituted by executive order. So I took the liberty to draft a bill to make it so patients could actually pick out a caregiver or somebody to advocate on their behalf that could meet with them reasonably, safely, and that. So I'll just give you a little synopsis. This act would entitle all residents of healthcare and assisted living facilities, nursing homes, group homes, veteran homes. It gives them a designated person to provide them with companionship, personal health, care guidance, and advocacy. I don't feel that any government or any executive order should insulate family members from seeing their loved ones at any time, whether it's COVID-related or not. These people can meet safely, just as the CNAs, the nurses' aides, and everybody. There could be safety precautions made, and family members should have the right to be with their family. I could go on with many stories. Just recently, my Bob had lost his dad. The last time he seen his dad, he was taken away in an ambulance. He was able to communicate with him by phone for about 2 weeks. The final week, he took a turn for the worse. He went on a respirator, and when he called in, they say he took a turn for the worse. And that was the end of it. He had expired, but his brothers, his sisters, nobody had access to see him in his final days. And I've heard these stories all too often. I'm not going to go on too much about them. I know there's phone calls coming in that are going to share their stories as well. So, and I also want to say I got an email from the Department of Health. They support this bill. They're in favor of it. So, okay. Thanks.
Thank you, Representative Nardone. Are there any questions at this time for Representative Nardone? Representative Potter, go right ahead.
Thank you, Mr. Chairman. And not a question per se, but Representative Nardone, I want to thank you for bringing forward this legislation. Like you, I also heard from a constituent who's dealing with a very similar situation of her husband being in a nursing home, and she's been unable to see him how she would like throughout this crisis. And truly a very, very heartbreaking situation. So I commend you for bringing forward the legislation. And in fairness, I understand where some of the opposition is to it, with trying to have those parameters to keep people safe and not have people in and out of a nursing home. But certainly I think we can look back in hindsight and recognize that there's been a lot of deviation from our public health policy. And if we're going to do that at all, I think it makes sense to do that for people who have a loved one that really need them there. So thank you again, and I'm happy to support the legislation.
Right, and Mr. Potter, I just made just comment on one of your says. The guidelines will be set by the Department of Health. So I understand too that, in a COVID time there has to be decisive action taken, but the Department of Health can set up the safety parameters, and I think this can be achieved. Thanks. But thank you for your support.
I think that's a very reasonable point, Representative Nardone. So again, thank you.
Thank you, Representative Potter. Representative Morgan, I see you're with us virtually. Would you like to comment? You're muted right now, Representative Morgan. There you go.
Yes, thank you very much. I couldn't support this more. This is necessary. I don't. My mother is 96. She is deaf. She has moderate dementia. She is not able to advocate for herself at all. When the lockdowns started, she was in an assisted living center. She's deaf. She couldn't talk to me on the phone. There was no way that I could help her. She got sick, was sent to the hospital. They thought she was going to die. And even though she was that sick, they wouldn't let me in to see her. And she couldn't advocate for herself, so she couldn't tell them what was wrong or ask for anything. She's still with me. Good news, she's still with me, but she has been to the hospital many times. At one point, she was actually treated by a doctor who was talking to her and couldn't figure out why she wasn't answering him. And finally, he called me. Now, this was after about 2 to 3 hours of treating her. And I said, well, she's deaf. And he said, oh, okay, that makes sense. Imagine that she was there being treated, and the doctor, because I wasn't there, couldn't figure out why she was there or how to help her. And so that's happened more than once. This is just so necessary. And honestly, anyone who's a designated caregiver, I am positive would take it seriously. None of us want to make anybody else sick, but our loved one, and that would include anybody, no matter what age they are, not just the elderly, any age. When you're there in the hospital, you're sick by definition, and you need somebody who's not sick to help you. So I really hope that this gets passed.
Thank you, Representative Morgan. Are there any other questions from the committee right now for the sponsor or Representative Morgan? Otherwise, we will move to our virtual testimony. Go ahead, Chris. Who do we have, Chris? Elizabeth.
Yeah.
Hello, Elizabeth. This is Representative Casey. I'm the chairman of the Health and Human Services Committee. I have you here to testify today on, I'm sorry what the number is. This is Representative Nardone's 5547. Elizabeth, if you would as well, I know if you can stay close to the phone because we're going to have you up on another bill shortly. But if you could just briefly give us your testimony regarding 5547 on patient visitation rights, please.
Sure, thank you. Good evening. My name is Elizabeth Perot. My dad is 72 and currently living in a locked dementia unit at St. Elizabeth in East Greenwich. He suffers from early onset Alzheimer's disease. My family and I feel like we have been fighting an exhausting and frustrating uphill battle to gain access to my dad since we were shut out last March. He has declined a great deal, not only due to the disease, but because of isolation and having very minimal interaction with his family. He has lost weight and now takes strong medication to keep his agitation at bay. I keep asking myself, what is the purpose of all this? I understand the Department of Health's goal, which is to keep COVID out of nursing homes. But when will the isolation of human beings outweigh the safety of the virus? By the way, my dad, as well as most of his unit, still caught COVID, even with all the shutouts in place. My dad recovered, thankfully, and is fully vaccinated. It has come now to a time when letting family in should be allowed. 30-minute visits 6 feet away aren't enough anymore. We need to go in and hold his hand and tell him he is loved and his family is there for him. We went every day prior to the lockdown. My dad needs us. How can he be denied his family, especially now that he is fully vaccinated? Why can't we get a rapid test, put on our proper PPE, and visit? A few weeks ago, my mom and I were allowed to have a compassionate care visit. It was the first time in a year that we could sit next to him and spend a few hours talking to him. Although he couldn't really speak and didn't remember our names, the next morning we were informed that it was the best sleep he had had in months. Family matters, and we have been left out for too long. I urge you to pass this bill and allow nursing home residents a voice, not only for this pandemic, but for future emergency situations. I appreciate your time and consideration on this important bill, as well as Bill 5543. Thank you and have a good night.
Thank you, Elizabeth. We appreciate your testimony. I know that it's almost like the saying, especially in Rhode Island, everybody knows somebody. I think everybody in this room has somebody who has been affected in the same way. Both my mother and my mother-in-law are in nursing homes. I haven't seen either of them in a year. This is a very difficult situation. We appreciate you taking the time to testify. Are there any questions from the committee at this time for Elizabeth? Okay, we're going to move on to our next testimony. Thank you very much, Elizabeth. We appreciate you calling. Hi, Charlie.
Yes.
Charlie, this is Representative Casey, Chairman of the Health and Human Services Committee. I have you online with us for House Bill 5547 regarding patients' visitation rights.
Great.
If you would go ahead and give us your testimony, if you could keep it a little bit brief, but please give us your story. Go right ahead, sir.
Sure, yeah. Thanks, Chairman Casey and members of the committee. So I submitted a written statement earlier today, and I'm going to spare you my reading that statement. I think you reps that just spoke, and Ms. Peralt, I think made a very compelling case. And, I've been saying for months that the only way somebody could not be in favor of reuniting families is if they're just not hearing our stories. My story is much like everybody else's. I'll give you a brief synopsis. I have a brain-injured mom in a nursing home around the corner. We live over in Bristol. I've got an Alzheimer's dad that my saintly wife decided to take in a few years ago. So he was with my mom every day. My wife and I were there every night, and my father's been asking me number of times a day, every day for a year now. It's a year this week. Why can't I see your mother anymore? Why can't I see your mother anymore? And the answer now is that he can. I've done a lot of research on this ever since Governor Raimondo reopened casinos and strip clubs back in June. In June, I've been yelling loudly to anybody who would listen, and it's time. I've done a lot of research. I've talked to the epidemiologist. We can safely have visitation. These old ladies and old men are dying in horrible isolation. They're spending the last months of their lives wondering why their families abandoned them. They don't understand. They've been vaccinated. We were kicked out. It made sense in the beginning. It doesn't make much sense anymore. Our facility most facilities already had an outbreak. The outbreaks came and went and they didn't come in from visitors. It's time to get back in there. And one of the unspoken ugly aspects of this whole issue that nobody wants to talk about is the significant resistance we're getting from the nursing home industry. You guys have been great. The reps and senators have been great. The Department of Health, there's a lot of gems in there who have great hearts. They don't work as quickly as some of us would like, but they're doing what they can, and they keep easing restrictions, and the industry, candidly, keeps finding linguistic loopholes to comply as minimally as possible and to keep us out as long as possible. And more staff on the insides of our facility and other facilities across the state and across the country are telling me that it's no longer industry's concern about us bringing COVID in. It's that they just don't want us to see what's going on in there. And that's no ethical reason to let these old ladies die alone.
Thank you, Charlie, for your testimony. We do appreciate it. Are there any questions for our witness at this time? Okay, Charlie, thank you very much. We're going to move on to our next witness.
Thank you.
Hello, Mr. Marshall?
Yes.
Mr. Marshall, this is Representative Casey from the Health and Human Services Committee. I have you online with us live to testify on House Bill 5547 regarding patient visitation. If you would, please keep it as brief as possible, but we do want to hear what you have to say. Go right ahead.
Okay. Thank you, Chairman, members of the committee, allowing me to appear on behalf of the Rhode Island Developmental Disabilities Council on this bill. We just have a couple of concerns in some of the wording here. We're not sure what the intent is, and when we check the wording, we got more confused. When we first read it, we assumed that group homes you're referring to include group homes for the developmentally disabled, but then the cross-reference over to the law for the definition goes to a section where it defines community residences, and at the end of that paragraph specifically excludes people who are mentally retarded, alcoholics, or drug abusers. So we're kind of confused whether this is inclusive or not inclusive, and we think that needs to be clarified. And then the second thing is that it also could cause some confusion in that it sets a lower standard than what is currently in the home and community-based services regulations for group home. So we think that we need to look at clearing up some of that language so that it doesn't cause a lot of confusion and people get caught up in that and can't get what they need. So with that, I'll take any questions.
Thank you, Mr. Marshall. Before we go to questions, I would ask you, if you would contact Representative Nardone and copy myself in by email with any suggested changes to the legislation to make this more palatable for everyone. And if there are any questions from the committee at this time, I'd like to hear them. Okay, hearing none. Robert, thank you so much. We're going to move on to our next testimony. Hello, Ms. Medeiros.
Hello, Chairman. Thank you very much.
How are you doing today?
Members. Good. How are you, sir?
Doing just fine. We're here on House Bill 5547 regarding patient visitation rights. If you could please keep your testimony brief. Go right ahead.
Yes, sir. The Alliance submitted a written testimony in regards to supporting this bill. We feel that, as we stated, COVID both highlighted and exacerbated the need to assure the presence of designated support people or person assigned advocates to patients for a variety of reasons in the bill. Assist treatment, interpret medical plans, procedures, provide needed companionship and health. My testimony is on behalf of the George family, in particular Mr. George, who was the patriarch, denied these rights and withheld on numerous occasions. Unfortunately, not all victims and their families are not able to be present, and that is the reason for an advocate to step in. This family is completely destroyed. It was a highly profiled case that was on Channel 10 News. I believe I included a photograph in my testimony for each committee member. This was taken at the care facility where Mr. George was at. This was following 3 falls. Family was not notified until after the fall and got FaceTime Zoom to witness this. His health had already deteriorated. Meds were being changed repeatedly. His health deteriorated, and they were in dire situation of getting him out of there. In attempts to try to remove him from the facility and get him to hospice for end of life, even more walls were put up. Beds weren't available. Meds were getting changed or need for meds to be changed. They were begging for hospice placement and could not get it. They were not allowed to have hospice come in to evaluate and check on him. The conditions that we're talking about here, many of these things existed in these care facilities, but now they were exacerbated and highlighted with COVID, unfortunately. Mr. George, the ending was horrific. And for all the families, for all the victims in these nursing homes, the isolation, the depression, the deterioration of health, it all contributed to their demise in many cases. Not only did I work with the George family, the Faber family, but other families. They described the distance between the physical distance during visitation, up to 6 feet or a 12-foot table put between an elderly man and his daughter outside during the summer on a summer visit that was finally allowed. I've had photographs not only of Mr. Faber, which I'm hoping that the committee can see this photo. It's absolutely horrific. There was a watered-down, kind of tempered version put on Channel 10 compared to the one I'm sharing with you. I do believe that only until the photo got out, and multiple photos, and it got to many people at the State House and higher up, that action was taken where we were able to move him into a hospice facility where he was died. This is totally unacceptable. The limited time and duration of visits, the limited number of visits, the inconvenience of when the visits are allowed, even during personal hygiene care between nurses and patients. The stories I have heard are horrific. Mr. George's case was absolutely the worst that I could even imagine. The Alliance for Safe Communities has passed bills successfully for violent crime, pedophilia, and elder advocacy. We currently have a surveillance camera bill in the nursing home in the Senate that we put in 2013 that went through this House. I'm hoping this is absolutely necessary. Its time has come. It's unfortunate that COVID had to open our eyes to just how serious these situations are and where we've gotten. If you have any questions, please, on the George family and what took place, or any of the other families that I've been able to advocate with.
Thank you, Ms. Medeiros. Are there any questions for Ms. Medeiros at this time? Okay. Thank you, Carolyn. We're going to move on to our next witness. We appreciate your testimony. Hello, Mr. Frazier. Welcome back to the committee. We have you here for House Bill 5547 regarding visitation rights for patients. If you would please go right ahead. If you could keep it extremely brief, we would appreciate it, sir.
I will do that, Mr. Chairman. Thank you once again, members of the committee. Scott Fraser with the Rhode Island Healthcare Association, representing 63 nursing homes in the state of Rhode Island. We are opposed to this legislation. The bill, in our opinion, does not contain as many concerns as H5543, which we will be talking about, I'm sure, coming up. Our residents already have access to many support persons during non-pandemic times, and one person does not have to be designated as support. Our main opposition with this bill is just in the last line. It states, shall not totally exclude their presence during a time of public safety concerns. In 2020, the Rhode Island Department of Health suspended visitations in order to curb the spread of COVID in our homes, and the above phrase would be in opposition to such a move. Suspending visitation went a long way to reducing the number of COVID cases and deaths in our homes, and if we are forced to allow access, even in times of emergency and in times of pandemic, that would put our residents at increased risk. And I'd just like to take a quick moment to address a comment that one of your previous witnesses made, that nursing homes are going out of our way to limit visitation, and nothing could be further from the truth. We are following the guidelines of the Department of Health, and we welcome visitation. We know how important it is for family members to visit their loved ones, but we can only go by what the Department of Health allows us to do. Otherwise, we would be subject to many, many sanctions. And the Department of Health can and does come in to visit our homes constantly for multiple surveys to see what's going on. So there's nothing to hide. And with that, I'll conclude my testimony, and I'm sure we'll be back to speak about the other bill.
Thank you, Scott. While I have you, what I'm going to do is just have you hold on the line, and as soon as I close the hearing on this bill, if you will just hold on this line, you're our last testimony on this bill, and I will have you in for the next bill for Representative Speakman. But let me just get to the questions and answers for you first. Are there any questions for Mr. Frazier?
I have a question for the sponsor.
Okay, go right ahead.
Okay, thank you. Representative, do I read this correctly? The first line says, notwithstanding any law, ordinance, rule, regulation, or executive order to the contrary, residents have a fundamental right to bedside companionship. That means that the issue that we had, where the governor prohibited visitors, this law would overrule that executive order.
Yes, to the best of my knowledge, yes. But, you know, I'm not a lawyer, so I have a tough time understanding all the litigious language. But that's how I wanted the bill drafted in my legal counsel.
Okay, so her executive order barring visitation would be voided by this law. That's as you understand. I'm not a lawyer either.
Yes, Rep. Speaking. That was my intent.
Yeah, so to Mr. Fraser's point, the last line, that means that under no circumstances could visitors be prohibited from
one designated person, yes,
okay.
Companion.
Okay. Okay. Thank you very much.
Okay. And the language can be tightened up in any way, just as long as the initiative is passed. So, okay. Thanks.
I have a question for Mr. Frazier.
Go ahead, Representative Morgan. For Mr. Frazier, go ahead.
Yeah, Mr. Frazier, are you concerned about liability, or just the fact that there was an executive order, so you were following the rules?
We are required to follow the rules that the Department of Health promulgates, and if we don't, we are subject to sanctions for not following those rules. So when the department or the governor says no visitation, we have to limit visitation. When visitation is allowed to be opened up, then we set up programs to have visitation for our family members. We are not trying to restrict it in any way. We are trying to follow the guidelines that the state sets forth.
Yeah, and I guess the point of this bill is to make it so that the executive order can't stop a designated support person from coming in. So you would be following the rules. The whole point of this is to make sure that an executive order can't stop a loved one from having support at the bedside. So I get what you're saying. There was an executive order. You're following the rules. We're not criticizing you or any of the healthcare facilities because they were following the rules. What we're doing is changing the rule.
Thank you, Representative Morgan. Mr. Frazier, if there's any response to that, you can go right ahead. And if there are any other... Go ahead, sir.
I certainly understand where the representative's coming from.
Yep, I agree. Okay, are there any other questions from the committee? I believe Representative Bia, did you have a question?
Yes, I think it was just my intent of that, where Representative Morgan just clarified that. Because if Mr. Fraser's intent was the violation of the law, then if this passes, then Mr. Fraser have no content of this again. Am I understanding you right, Mr. Fraser?
Well, I think in this case we need to consult the attorneys on this because in any situation such as this, if there is an executive order during this, what is called a public health emergency, I believe no matter what, my understanding is that the executive order would override, and then if there is a breach of that, then obviously it would be a court case in a couple of months. In this case, if there were a breach early on in COVID, they probably wouldn't be even getting to court by now. So we need to take this kind of all with some degree of certainty that, you know, in any case, a facility doesn't want to break the law. We all want to do what's best for the patient. So I think maybe there might be some language tightening that we could do with this bill, and Representative Speakman's bill is similar as well. So hopefully we can pull something out of this and get something into law that works for all entities and all the interested parties. Because, I mean, we as legislators are interested, our family members are interested, and the facility management is interested as well. I have a question from Representative McLaughlin, and after that I'm going to close this hearing and open up the other one for the next bill which is very similar. So, and we have very similar testimony from everybody. Go ahead, Representative McLaughlin.
Yes, Mr. Chairman, thank you. To add to the conversation in reference to the executive orders that were promulgated to the nursing homes, in reference to that, this past year, the General Assembly had no say. To add to that, besides legal questions in reference to that, I currently have a bill in that would bring the General Assembly into this in reference to any health crisis. The General Assembly is to meet within 30 days, okay, to take up these executive orders. So I just want to add a little clarity to this conversation. Thank you.
Thank you, Representative McLaughlin. Are there any other questions right now on House Bill 5547? Okay, thank you, Representative Nardone, and I hope our verbal testimony, especially Mr. Marshall, gets a hold of us so we can try to clean up this language. And I think Rep. Speakman, we might all end up having a conference and seeing what we can do with this. So right now, Representative Speakman, if you prefer, you can take the stand where Rep. Nardone was. As far as camera angles and things, you could be on the camera, or if you'd like to do it from your seat, you can do that. It's your choice.
I'll stay here. It's okay. Thank you.
So I have Representative Speakman for House Bill 5543. This is regarding rights of nursing home patients. Some of this material is similar to what we've just heard, and we still have Mr. Frazier on the line for testimony. Go right ahead, Rep.
Thank you,
Speakman.
Mr. Chairman. As with Representative Nardone and probably everyone else in this room, I have heard heartbreaking stories from families of nursing home residents about their inability to see their loved ones during the pandemic. And I am hoping that Representative Nardone and I can find common ground on this. The bill that I propose is narrower, and it does acknowledge the ability of the governor to issue executive orders in this matter, but it directs the Department of Health to establish regulations for nursing home residents to designate an essential caregiver who who could enter the nursing home during an emergency to provide care and emotional support. So the Department of Health would determine the conditions under which this would be possible. So it's narrower than Representative Nardone's, but it does address the same issue and it's in the same spirit. So I'm hoping I can work with him and the other advocates to get this done so that essential caregivers can enter nursing homes under most conditions during a health emergency, which we hopefully don't have in the future. Thank you.
Thank you, Representative Speakman. Are there any questions for the bill sponsor, please, at this time? Okay, we're going to go right back to Mr. Scott Frazier from Rhode Island Health Care Association. Scott, I know where your position is. If you could please just go ahead and explain.
Yes, thank you once again, Mr. Chairman and members of the committee. The Rhode Island Health Care Association is opposed to this legislation because it makes the essential caregiver program mandatory. Presently, it's voluntary, and this would put additional pressure on nursing homes because our staff would have to monitor the essential caregivers, what they're doing, where they're moving within a facility, and for training the essential caregivers. Presently, nursing homes are responsible for properly training these essential caregivers as dictated by the Department of Health. It does allow the program to be suspended for 30 days during a declared emergency, but as we know in 2020, the declared emergency is still going on into 2021, and that the Rhode Island Department of Health suspended visitation for far longer than 30 days. Rhode Island nursing homes, as I pointed out earlier, did not voluntarily suspend visitation. We follow the orders of the state and federal agencies, and we do understand how important human contact is with loved ones. But our first and foremost responsibility is the health and safety of our residents. When a program like this is voluntary, we'd expect a small percentage of family members to take part, but if it becomes mandatory, then I would expect families of most, if not all, residents would want to become essential caregivers. And as noted above, that would just take a lot of time, staffing, effort, and really take activities or take duties away from the direct care that our members would give. I also would raise the question as to why this would be extended for 60 days after the end of an emergency declaration, because once an emergency is declared over, regular visitation would resume and there wouldn't be a need for the program. But for those reasons, we do oppose this legislation. Thank you, Mr. Chairman.
Thank you, Mr. Frazier. Are there any questions for Mr. Frazier from the committee? Representative Speakman, go right ahead, please.
Thank you. Thank you, Mr. Frazier. In normal times, are there state requirements for visitation, or is it at the nursing home's discretion to determine the hours and the folks who can visit?
In normal times, there are people that do act as essential caregivers who come and go. I mean, family members, and they're not limited other than to at the times of the regular visiting hours.
So are they does the state require that nursing homes allow essential caregivers?
They did pass regulation, I can't remember when, a couple of months ago, to allow essential caregivers under a number of conditions, and I don't have that right in front of me, but they did open that up. I think it was right around Christmas time, actually. It was just before Christmas they began the program of essential caregivers.
So one of the concerns that's been raised by a number of folks in my district is that nursing homes are being too strict now, as people have gotten, you heard Mr. Galligan say this, he is one of my constituents, and that nursing homes are essentially not allowing essential caregivers in, even under the more relaxed guidelines, because it's easier not to have outsiders come into the nursing home. How do you respond to that claim?
Well, certainly when essential caregivers first started in December, there still was a high degree of COVID. And what we're seeing as visitation is relaxed and the degree of COVID is going down, I think you're going to be seeing, if not already seeing, an opening up of more visitation, of relaxing all of the rules and regulations, not just at the state level, but as our homes see the number of cases go down, that's going to make it easier and give us more comfort in allowing more and more people in.
But there's no requirement that a home has to let people in. Is that correct?
Visitation is opened up, but there are still guidelines that homes need to follow. And yes.
I guess I'm asking the opposite question. If a home wished to exclude visitors altogether, does it have the discretion to do so?
I believe only if there's an outbreak of COVID.
Okay, thank you. Thank you, Chairman.
Thank you, Representative.
Mr. Chairman, I have a question.
Go ahead, Representative Morgan.
Mr. Frazier, you seem to be objecting more to the designation of it being an essential caregiver. I noticed on Representative Nardone's bill, he calls it a support person. So, I mean, I get that kind of there's a difference between a caregiver and a support person. Is it your main objection that you're saying you'd have to train them if they were a caregiver? I think, you know, a client, a wife of 60 years, wasn't able to go in and be with her husband when he died. And they knew he was dying. And they called her and said, he's dying. And she still wasn't able to go in and be by his side.
What's that?
Yeah, to give him care. She's there to hold his hand. So is that your objection, that this legislation calls it an essential caregiver?
To me, the language is different, but it seems to me that the services are the same in both this bill and Representative Nardone's bill. And it is unfortunate in the case that you mentioned, because my understanding was that all of our homes were allowing care visits at end of life. Even in the midst of COVID outbreaks, we were doing all we could to get people in for end of life care, and I'm not aware that that was limited, and because that, as I say, our homes, if a person was at the end of their life, we would allow at least one family member in with proper PPE, etc.
No, he died without her.
Thank you, Representative Morgan. Are there any other questions for the witness? Yes, go ahead. Representative Potter, go ahead.
Thank you, Mr. Chairman. Mr. Fraser, I'm drawn back to, I'm just trying to figure out, is your opposition mostly rooted in a belief that having these caregivers going into a nursing home is going to make the risk factor of a COVID spread more so? I kind of picked that up from your earlier testimony, but now it seems like there's more opposition just based on some of the language and the guidelines. Is it mostly rooted in the risk of COVID spread from having people come in?
Well, it's a combination of both. During a declared emergency or during the height of a pandemic, yes, it does certainly increase the risk of COVID spread. But right now, under some of the guidelines that are offered by the Department of Health, nursing homes are required to train, monitor, and make sure that essential caregivers do not only go through designated areas or are only allowed into certain areas, and it's up to our staff to monitor them, to make sure they are properly clothed in PPE, to make sure they are performing the proper functions. And again, those are requirements as set up by the Department of Health. So it does bring a lot more work on the part of our staff to do that. But right now, it's not mandatory. And if it's mandatory, that just increases the amount of work that will be placed upon our employees to allow this to happen.
Okay, understood. You mentioned that you represent, was it 63 nursing homes?
Yes.
Do you know roughly how many positive COVID cases your nursing homes have had in them?
I don't have that total number, no. I know the numbers are certainly going down, which is a very good thing.
Do you happen to know how many patients have passed away?
It's been in the hundreds, certainly, and it's certainly a high percentage. I know from what I've read as well, as I'm sure you have.
And do you happen to know how many cases or staff members within your nursing homes have passed away?
I don't have a number of that. I know there has been a small number of staff members who have passed away.
All right, thank you.
Thank you, Representative Potter. Are there any other questions from the committee at this time? Okay, hearing none, we're going to go on to our witness testimony. Chris, who do we have on the line? Yes, hello, this is the chairman of the Health and Human Services Committee, Representative Casey. Who am I speaking to?
Hi, Representative Casey. It's Charlie Galligan. Did you miss me?
No, I didn't miss you, but thank you very much. I'm glad we caught you again. Sir, I know you testified on the previous bill, and the subject matter is similar. If you could keep it extremely brief, go right ahead.
I will. Sorry, I got interrupted. I missed what's gone on in the interim because I got called away for Alzheimer's CNA duty. I did hear a blip of Scott Fraser's response to some of what I said, and he was saying that the industry greatly encourages visitation. I might ask him why then, since the governor announced an essential caregiver plan on December 14th to be enacted December 21st, almost no nursing homes, including mine, have enacted it. So that doesn't make any sense. I mean, I resent the fact that we're even having to bother you guys to create legislation to force the industry to let us in. So he's either uninformed or disingenuous, but I would advise him to maybe spend more time talking to CNAs and nurses on the inside who've been the true heroes through this pandemic, who've been working doubles for a year now rather than the administrators and CEOs. So that's that. I had a Zoom with the prospective owners, new owners of my mom's facility, just that ended like 10 minutes before this hearing began this evening. And they said that when I asked them about visitation, they said that their hands were tied by the legislators. And those are prospective new owners coming in. So there's a lot of, you guys haven't tied their hands at all. So there's a lot of misinformation going on. There were outbreaks when Fraser said that, keeping us out kept the outbreaks down. Not at our place and not at most places. The outbreaks still came and went. So I appreciate the job that he has to do for his members, but I think, hearing our family stories, and this is why so many families don't want to speak up. I get a lot of flack. I've gotten a lot of flack from the industry for speaking up, and there's so many other daughters and sons and husbands and wives across the state that have told me, thank you for speaking up, but I can't put my name to this because I don't want to be given a hard time. I don't want my mother's care affected. What does that tell you? That's abhorrent that anybody should have that concern, but living my life, it's very understandable. So look, you guys are doing a great job. I know you've got a long hearing, and I appreciate you listening. I am interested to know, how are you going to reconcile the language with 5543 and 5547? Could you answer me that?
Oh, Charlie, not at this time. I appreciate your testimony. I've got another 292 people that are going to call on the next 4 bills. So it's not going to happen today, but we'll be getting together on these type of things to see if we can come with a solution that is resolute and it's never, when you negotiate and when you compromise, nobody goes away happy. That means you did a pretty good job, so we're going to do the best we can.
Okay, I appreciate it. The sooner you can do it, the better. I know you're busy, but people are dying every single day in miserable isolation, and I don't want you guys to ever forget that. Okay, thanks for all that you're doing. I appreciate it. Okay.
Thank you, Charlie. We appreciate your testimony. Okay, we'll have our next. Hello, Ronnie.
Give me the music.
Hello, Ronnie Ferraro.
Yes.
Hi, this is Representative Casey. I'm the chairman of the Health and Human Services Committee. You're here to speak on House Bill 5543. Yes. If you would, please keep your testimony brief, but go ahead. We would like to hear your story.
I will, and I also have a written testimony I did submit, so I know you have that for 5543.
That's wonderful. I'm going to give you 1 minute, please. Go ahead.
Okay. I've been listening to the banter back and forth, and really, my husband is in a dementia unit. It's been in dementia units for years. I have been his essential caregiver for the last 7 years that he's left home on a 12-year battle for Alzheimer's since he's been 62. And family caregivers like me who are essential, we contribute to their care. So guess what? We are helpful to the staff, and if anything, they want us back in. We're not going to overrun the facilities. It's usually 1 or 2 key family members that are in a day-to-day struggle with their loved one battling Alzheimer's disease or any kind of cognitive issues or dementia. And, they think they kept us out to keep the virus out, but it came in with the staff. Understandably, they shut down in the beginning. We didn't know what we were dealing with. Now we have so many tools. We have testing, we have PPE, we have vaccines. They're still not letting us in beyond a 30-minute socially distanced visit. As we all know, that doesn't work when you have a non-communicative person with Alzheimer's disease that can't advocate for himself. There's also something called a compassionate care visit that's in the regulations as distinguished from an end-of-life visit, and they're fighting us on that. We have to fight tooth and nail to get a compassionate care visit, which I just had finally recently with my husband. After 11 months, I found so many issues. I issued a complaint with the Department of Health. So this has got to stop. Families have to be let back in, the ones that are really critical to their loved ones' care and being their advocates. I listened to Rep. Morgan and the horror stories she told. I can understand what she must have gone through with her mom. Just one more thing really quick, because you'll be able to read my testimony. The hardest thing in life is losing a loved one, a parent, a spouse, a sibling, and God forbid a child. The second hardest thing is looking at your loved one's picture every day for nearly a year and reminding yourself they're still on this earth, but yet you cannot see them and you can't talk to them because they can't communicate. And hoping the reunion comes soon because you know time is running out. So I ask for swift passage of this bill. Thank you for listening.
Thank you for your testimony, Ronnie. Are there any questions for our witness, please, from the committee?
Yes. Representative Casey.
Representative Mazzanaro, you trying to get my attention? Okay. Representative McLaughlin, go ahead.
Yes, my heart goes out to you and many others whom you have that situation. Hopefully, we'll get this resolved if we can. If you could, at some time tomorrow or the day after, give me a call personally, and I will convey this to the governor. My number is 741-1834. I look forward to hearing from you. Thank you.
Can I just say something really quick?
Yes.
We have been writing, a group of us at my husband's nursing home, his dementia unit, we have been writing since June of last year, the Alzheimer's Association, the governor, the Department of Health. I can't tell you how many letters. I've written so many letters, I can just write stuff off the top of my head now because I've written so many letters. And we've gotten absolutely nowhere. And it's a year this week. And if that doesn't hit you right in the gut, anybody that has someone suffering from Alzheimer's disease and been on this journey this long, to be forbidden to be with your loved one, the commitment you made when they were diagnosed and that's ripped away, it's horrendous. And all these people that have spoken, in our group and beyond, I mean, they all feel it, and it's very frustrating. So we hope something can get done before
Thank you for your testimony. If you would, please call me at 741-1834.
And what was your name again? I'm sorry, I missed your name.
Representative McLaughlin. We have a new administration that's taken the helm, and I personally will make a phone call to the governor tomorrow.
Okay, great. Thank you very much. Yeah. Thank you for the time.
Thank you, Ronnie. Ronnie, we're going to supply Representative McLaughlin with your phone number as well.
Okay,
we'll take care of that.
Okay.
Are there any questions? If not, we'll move on to our next testimony. Okay, thank you. Elizabeth Perot, by the way, she did testify on the other bill in favor. And just for everyone else's edification, there was written testimony by Leading Age Rhode Island. It was against the bill, and Miss Susan Hodgkin, who was for the bill. With that, are there any closing comments from the sponsor? Okay, I'm going to close the hearing on 5543, and we just closed 5547 as well. We're going to move on to one bill by Representative Vella Wilkinson. It's House Bill 5375. There's one person for virtual testimony. I'll give you a brief synopsis. This is regarding accident and sickness Insurance policy, with regard to insurance policies. Okay, this act would increase the mandatory insurance coverage for hearing aids from $1,500 to $2,000 per ear every 3 years. In addition, the amount of insurance coverage would no longer be based on the age of a recipient. Representative Vella Wilkinson is currently in another committee meeting, so she is unable to give any testimony. We do have only verbal testimony by one person. Chris is going to try to get them on the phone right now. Thank you, sir. Hello, Mr. Marshall.
Hello, how are you doing?
How are you doing, sir? This is Representative Casey, Chairman of the Health and Human Services Committee. You are here on House Bill 5375. It does state that you have no position. Representative Vella Wilkinson is unavailable to be with us. She's in another committee meeting right now. If you could give us any information regarding the merits of this bill or what it intends to do, we would appreciate that. And if you could explain who you are and who you represent.
Okay, thank you again for allowing me to appear on behalf of the Rhode Island Developmental Disabilities Council. We have taken a look at this bill and think that it is long overdue, which is why it's here. It's been here for a few years. Right now, the situation is that the amount of reimbursement for hearing aids has not been increased since 2006, and it was already very low. And also right now it makes a differentiation between whether that hearing aid is going to someone over 19, over 19 or under 19. If they're under 19, they get $1,500 for a hearing aid. If they're over 19, they get $700 for a hearing aid. You can't buy a hearing aid actually for either of those prices. You already have a significant amount of money you need to put in on top of that. What this bill would do is bring that up to $2,000 and eliminate the age differential. We think you should give it good consideration. I have submitted written testimony, and I can try to answer any questions.
Thank you, Mr. Marshall. Are there any questions for Mr. Marshall at this time regarding House Bill 5375? Okay. I have no one from the committee. All right, sir, we're going to end up closing this bill, this hearing on 5375. Representative Bennett, would you please mute yourself?
I'm trying to ask a question.
Oh, I'm sorry.
Make a statement.
I couldn't hear you. Go right ahead, sir.
As you know, I wear hearing aids, and they cost $5,000 for the hearing aids. If anything happens to them, if you don't have the extended warranty, which is very expensive, you're out of luck. And without your hearing aids, you're essentially left isolated from other people. Thank God for modern technology, I'm able to hear you, and when I'm in the house, I can go on the loop and I can hear. When I got my hearing aids, it was $750 that my insurance company gave me towards the $5,000. This bill would go a long ways with helping, but it'd still be very expensive. The hearing aids are expensive. That's all I got to say. Thank you.
All right, thank you, Representative Bennett. Are there any other questions for the committee or any statements? Okay, we're going to close House Bill 5375. Thank you, Mr. Marshall, for your testimony. All right, we're going to move on to the next bill. That's all set, Chris. We'll work this out. Okay, folks, we are nowhere near the end, but we are making progress. So thank you very much for hanging in here with us. Representative Casimiro, are you with us?
Yes, I am.
Representative Casimiro, we are going to take House Bill 5548. I will let you know that we have for the committee's edification and everybody who is listening or watching at home, this is how we are going to operate the hearing regarding this bill. There are 3.5 pages of witnesses. I believe there's 30 witnesses on a page. As far as I know, the majority here are in favor of this legislation. So what I'm going to do is I'm going to call on the first, after we hear the explanation of the bill from Representative Casimiro, I'm going to call on the first 6 witnesses. Each witness will have 2 minutes to explain their position. Some of them are business people in this field. They will have the opportunity for 2 minutes of testimony. Then I will find the people who are not in favor of the bill, and I will give them each their 2 minutes. And then I will take the calls, or I will make calls to everyone else on the list. Each person will be limited to 1 minute, and I will hold strictly to that because after this bill, we have 4 other bills that we need to get through. So hopefully everybody understands that. Representative Casimiro, if you would, please introduce your bill and let us know.
Thank you, Chairman. Thank you, and members. Thank you, members of the committee. I appreciate the late night tonight. But back in 2019, when there was some problems with vaping and THC, I actually came out in support of a ban for vaping products, flavored vaping products. And then I sat down with experts in the industry. I sat down with people who use vaping as a way to quit smoking, and quickly changed my tune on a full-out ban on flavored vaping products. What happened in 2019 and early 2020 was a knee-jerk reaction by our governor when she banned flavored vaping products. Flavored vaping products help adults quit smoking. Again, they help adults quit smoking. This act would regulate the manufacture, distribution, and retail sales of vapor products in Rhode Island. The act would provide the Department of Health with the authority to oversee the permitting for manufacturing, distribution, and retail sale of vapor products. This act would set forth labeling, marketing, safety, and record-keeping requirements for manufacturers, distributors, and retailers of vaping products. This act would also prohibit the sale of vapor products to minors. And that's very important. It would prohibit the sale of vapor products to minors and would provide penalties for noncompliance. You're going to hear from a number of witnesses tonight. Vaping products help adults quit smoking. If you want to ban anything, ban big tobacco, ban cigarettes. Vaping products help people quit smoking. So I'm going to I know you have a long night and a lot of witnesses. I'm going to just turn it over to the experts right now, unless anybody has any questions for me.
Representative Casimiro, thank you for your brevity and for your explanation. Are there any questions from the committee? Okay, we're going to move on to our testimony. Like I said, first we're going to take 1, 2, 3, looks like at least 4 or 5 witnesses on the pro side of the bill. Then we will take some opposition, and then we will get through everybody else with a limited amount of testimony as far as time is concerned. Yes.
Gregory?
Hello, Gregory?
Yes.
Gregory, this is Representative Casey, Chairman of the Health and Human Services Committee. I trust you've been listening along with us. We're going to have a brief testimony from everybody tonight. If you would, please go ahead and state your case regarding 5548.
Thank you, sir. Representative Casey and members of the House Health and Human Services Committee, my name is Gregory Conley, and I currently serve as president of a nonprofit called the American Vaping Association, which advocates for government policies that encourage adults to use vaping products and other non-combustibles to get off smoking. And we are here tonight to urge you to support the enactment of H 5548. it has now been about 18 months since the lung condition known as EVALI started popping up nationwide. And as the sponsor mentioned, there was a time period of great confusion where even the CDC was saying, we just don't know what is causing this. And some state governors, including the former governor of Rhode Island, reacted to this by saying, we're just going to essentially eliminate the vast majority of the industry. And what you have seen in Rhode Island and what we have documented from Massachusetts is that this bans don't actually stop the sale. What you have is cross-border sales. You have a great increase in Snapchat dealers that are not going to be checking IDs. I think you're going to be hearing some great testimony tonight from individual vape shops owners as well as vapors in the state of Rhode Island, adults who have used these products to quit smoking. They all want to be part of a real solution that allows adults to continue to access these products, particularly ones that the FDA is now reviewing through its pre-market tobacco application process, but they also want to keep these things out of the hands of minors. Glad to answer any questions, but I know you have a long night ahead of you, so thank you very much.
Gregory, thank you so much for being brief. We appreciate the concise testimony. Are there any questions for Gregory from the committee at this time? Okay, thank you. Hearing none, Gregory, we're going to move on. We appreciate your testimony, and we look forward to working with you. Hello, Gino. This is Representative Casey, Chairman of the Health and Human Services Committee. You are here to testify on 5548. If you've been listening online, you know that we are keeping everything brief today. If we could dispense with the pleasantries, you can go right ahead into the testimony. Thank you.
Thank you. My name is Dino Bakari, and I'm a local business owner here in Rhode Island, and been in business here for going on 8 years. I have a great team of 15 in our business, Whitehorse Vapor. I want to thank Julie Casimiro for the stance that she's taken on this topic, and she was at first she was taken back, and she was really, and she became very open-minded, and just she puts a lot of effort into to learn more. And the science of these products, it's undisputed. Eliminating smoke out of a smoker's daily life is crucially important. And these products, unlike other alternatives that have come up for many, many years now, have been a failure. These products have proven to be a success. And we've converted thousands of adult smokers in this state, my company, very proud of it. And this bill is a good bill, has great common sense injected into it. And I think that the enforcement piece, you'll see as you read more through the bill, the enforcement piece is going to be a very good tool in order to make sure that we keep any type of vapor product out of the hands of minors. And I can speak for every other business owner that's going to be testifying tonight. That's never been our goal, it never will be. But there's adult smokers that need to stay off of cigarettes, and vaping has proven very successful in this state. And that's all I have. Thank you so much.
Thank you for your testimony, Dino. We appreciate your brevity. Are there any questions? Okay, we're going to move on to the next witness. Hello, Ryan. This is Representative Casey, Chairman of the Health and Human Services Committee. We are short on time today, so I would like to dispense with the pleasantries, and if you can go right ahead on House Bill 5548.
Yes, hello, my name is Ryan Cummings. I am a fellow vapor. In the beginning, when Governor Raimondo banned these vapor products, the day of the signature of the bill, the FDA, one of the doctors from the FDA stopped and had a extensive conversation with us, and they did extensive scientific studies on all of the products that are out there, and all of the adult vapor products are highly regulated, but they were to be found 95% safer. and none of the adult vapor products that you get at regular vape shops had the vitamin E acetate. All of the CBD oil came back positive for the vitamin E acetate. That is what is causing the lung condition Ebola. And as soon as that scientific study came out, they, in hindsight, apologized for accusing the vapor industry of causing it. So I am in favor of this bill, and I would appreciate everyone to be in support of it.
Thank you, Ryan. We appreciate that. Are there any questions for Ryan? Okay, we'll move on to the next witness.
Rick McAuliffe is on.
Yep, great.
I will be
Hello,
very
Rick
quick, as I know you have.
McAuliffe. This is Representative Casey calling. If you would turn down the microphone in the back. We're glad to have you here in the testimony for 5548. Go right ahead with your testimony, as we are short of time today.
Absolutely. Thank you, Mr. Chairman and members of the committee, for your time. I know you have a busy night. I'm here on behalf of the Campaign for Tobacco-Free Kids and the American Heart Association. Let me just say this. The sponsor, Representative Casimiro, is a good friend and has been an absolute champion when it comes to children in our state, and actually specifically youth and health. I've testified 3 times so far this year on her legislation. Unfortunately, this legislation we are opposed to. While the purpose is to obviously get people off cigarettes, it has an impact, unfortunately. Flavored tobacco, flavored vape has an impact on our school children. We know that over 20% of high school students actually admit to vaping. That's this year. And almost all of them, according to the FDA, 80% of them, tobacco users start with flavored products. The Behavioral Health Development Disability Hospitals, Buddha, and DOH have serious reservations on this, and I would strongly recommend that the committee members talk to them regarding the issues that they have, which I think would give more clarity to this issue. Just to let you know that Massachusetts ended the sale of flavored e-cigarettes almost 2 years ago, and Connecticut was all set to do it as well, and the COVID happened. They were planning on passing it this year. New Jersey and New York has done it as well. We need to do the same thing in Rhode Island, and I ask that the committee respectfully talk to the experts in the health department and Buddha and get all the information they need. And I think based on all that stuff, that's why we're opposed to this legislation.
Thank you, Rip. Thank you, Mr. McAuliffe. We appreciate your testimony. Are there any questions for Mr. McAuliffe? Okay, we're going to move to our next witness. Okay, so if you could just, the other sheet should match this one, I think. So just go ahead and just fill those names on the other sheet, circle them, and I'll take the other ones out. That's going to stop. Are we having trouble reaching somebody?
I'm trying to do a couple of posts.
Okay.
I'm trying to get to number 34.
Okay. At this time, is there anyone on the committee who would like to make a comment at this time? Okay. We're just waiting for our next testimony.
Do you want to testify tonight? No? Okay. You went online and signed up to testify. Do that now? All right. Thank you very much. No luck there. Can I just start on the list and we'll call when we're done? It doesn't seem to be working that one.
Okay, just for the record, we were trying to call some of the people that were opposed to this legislation, and we're having trouble reaching them, so we're just going to continue on our list in the way that we've received it from the sign-ups. And please keep in mind, I am going to keep testimony extremely short, up to only 1 minute per person. And at this time, I will turn the meeting over to Representative Donovan. If you want to take this seat, that's fine. Just slide right over. Thank you. They're going to have the call sheet right back to you. All right. I'll be right back. Okay.
Hello, this is Representative Donovan. You're here to testify on 5548. Please state your name.
Yes.
Go ahead.
Anthony Belsprito.
Yes, go ahead.
Yeah, so the reason I definitely agree with what Julie Cashmere wants to do in her bill. You know, the whole thing is we're trying to get people healthier due to the current circumstances with COVID and everything else going on. You know, forcing people to go back to cigarettes because most people that smoke tobacco flavors, they want a cigarette. They're like, if we're going to taste something that tastes like tobacco, we are going to just smoke our regular cigarette. You know, so the flavors definitely entice people of all ages. I mean, I'm a 41-year-old man. I smoked Marlboro Reds for, 23 years. Haven't had a cigarette in almost 9 years. And that's due to the flavors. When I was smoking tobacco flavors, I was going back and forth with cigarettes. It wasn't until I got the flavors that I said, you know what, this tastes amazing. Why would I want to smoke a dirty ashtray? And not to mention my health and everybody else that I know that vapes, their health has improved significantly. I used to get bronchitis since the time I was in high school up until I quit smoking cigarettes. Knock on wood, I haven't had bronchitis in over 9 years. My stamina, my health, I mean, my doctor says you haven't been this healthy in we don't know how long. So I just see with my current condition and people that I know that smoke for 40 plus years, their skin tone changes and their overall health has just improved.
Yeah.
And I think it's just detrimental. And basic rights of a person, an adult should have the right. It's 21 and over now nationwide. And I feel that at 21, you're an adult at 21. You should be able to make your own decisions. We shouldn't be governed and told not to have that. You can go to a liquor store and buy Swedish fish and whipped cream vodka and everything. I'm sorry.
Thank you, sir. That's 1 minute. Could you wrap it up, please?
Yeah, so, I definitely am for what Julie Cashmere wants to do. And that's pretty much my statement.
Yes, thank you for your testimony.
We appreciate your time. Thank you very much.
We have Guy Bentley, number 11 on the list.
Okay. Mr. Bentley, this is Representative Donovan. You're here to testify on 5548. You may begin.
Thank you so much for allowing me to speak. I know you've got an incredibly busy night tonight, so I have submitted written testimony, so a lot of what I would say will also be in there as well. Just to bring up the point that vapor products are now fully regulated by the Food and Drug Administration, including e-cigarette flavors, and they will only be allowed to be sold on the market if they're approved to be deemed as necessary for the protection of public health. So what we would say on this bill is that it's important to note if banning e-cigarette flavors, as Rhode Island does at the moment, stays in position as it is, products that the FDA could approve this year to be appropriate for the protection of public health would be illegal and not be available for sale to people trying to give up smoking in Rhode Island, which could be a massive detriment to public health and reducing the burden of smoking-related disease by restricting these flavored products. But I will refer you to my written testimony, and thank you so much for allowing me to speak.
Thank you, Mr. Bentley. Okay. Mr. Andrews, this is Representative Donovan. You're here to testify on Bill 5548. Please keep it brief. Go ahead.
Thank you very much. I want to thank the members of the committee for hearing our testimony. I realize it's late. I will try and keep it brief. However, I want to specifically thank the sponsors of this legislation for recognizing the science when it comes to this and acting appropriately. The science is overwhelming. E-cigarettes are proven after analysis of thousands of academic studies to be 95% safer than combustible tobacco, and they are twice to 3 times as effective as any other quit mechanism. By trying to help adults quit smoking, this is a bill that will save lives. According to Georgetown University Medical Center, extrapolating from their research by some of the US's best cancer researchers, over 35,000 people in Rhode Island would have their lives saved if they took up vaping as opposed to smoking. So this bill has the potential to save 35,000 lives, according to Georgetown University Medical Center academics. It's also important to note that studies have repeatedly shown that flavors, which this bill will now allow for, are absolutely vital for helping adult smokers quit. And this was a recent study just last week from 10 of the world's top experts in cancer prevention and public health, published in a peer-reviewed journal, which proves this.
Okay.
This is all in my written testimony,
Okay.
so please read my written testimony, and I'll let you move on to the next speakers.
Thank you, Mr.
Thank you so much for your
Andrews.
time.
Thank you, Mr. Andrews. We're waiting for our next caller. They're not here.
All right, that's up. Hold on a second. Got a live one on line one. Margarita.
Hello, this is Representative Donovan. You're here to testify on Bill 5548. Please be brief.
Yes,
Go ahead.
I want to say that I almost died off of nicotine regular cigarettes, and I chose to do nicotine-free, combustible cigarettes free.
Yes, and so you're here to support the bill or not to support the bill?
Yes, I'm here to support the bill.
Support the bill, okay. Thank you. All right. We're waiting for the next caller.
Good.
Yeah, that's really strange. Yeah.
Joshua. You sign up to speak on Bill 5548? Can you show that to me tonight? All right, I'm going to screen now, okay?
Hello, Joshua. This is Representative Donovan. You're here to testify on Bill 5548. Please be brief.
Okay.
Go ahead.
Well, I mean, I've been vaping for the last few years, and the only reason that it stuck was because of the flavors. And I think it's good to have them back for everybody that wants to get off smoking. They should have the option. You know what I mean? It's an opportunity for people that have been smoking for 20 plus years, like I was, to get off cigarettes, because I was, I feel better now from vaping than I did when I was smoking cigarettes. So I just think it should be an option for people to be able to have flavors.
Thank you for your testimony, Joshua. Hello, this is Representative Donovan. You're here to testify on Bill 5548. Please state your name for us, please, before you begin. No? No. Okay. All right. Next one. If you do want to testify, please stay by your phone.
Did you already speak? Where's the account? Did you sign up for the phone number? That's really how we do that.
Hi, this is Representative Casey, Chairman of the Health Human Services Committee. Who am I speaking to?
Nathan Fegman.
How you doing, sir? You have 1 minute. Go ahead and testify on 5548, please.
Okay.
Go right ahead, sir.
What exactly?
Are you in favor of the legislation?
Yes.
Okay.
Well, no, as far as opposing it, or?
Are you in opposition of this legislation, or are you in favor of it?
I'm in opposition.
Okay.
I want to bring the flavors back.
Okay. Go ahead and give me a quick synopsis of the reasons.
Well, I used to smoke since I was a teenager, and I've always hated it. But the vaping has been the only way that I could quit, and the most enjoyable aspect of it is the flavors. It just makes, even still, I don't even vape nicotine, but now I just vape for the flavor, and because it's a lot better. I don't find any health issues. I'm as healthy as a horse, and that's about it. It just makes things difficult. So now, I can't get anything that's enjoyable for me, and it's been pretty tough without it.
Okay. Thank you for your testimony. I appreciate that.
Thank you.
All right. Okay, for those of you who are watching at home or listening at home who are waiting to testify, please stay by the phone. We are trying to reach everyone who's signed up to testify. I will be giving you each 1 minute to testify. I've got to move through this legislation as quickly as possible. I still have 4 more bills and approximately 200 calls.
Right now. Ready? Okay, hold on. What's your name? Carlton.
Hello, hello, Carlton. This is Representative Casey from the House Health and Human Services Committee. You're here to testify on House Bill 5548. Go right ahead.
I just learned about this bill today, so forgive me if I misunderstood it. But I do believe this is regarding flavored vape products.
It's regarding vape products in general, but we will include flavor.
All right. I didn't really prepare anything. I didn't think I was going to get the chance to speak, but I do just want to say that these products, I help people stop addictions every day in our store and work towards healthier lifestyle literally every day, if not multiple times a day. And so with the use of these products that, I'm able to help people enact change in their life, put two heavier restrictions on these products, and, pull them out of reach of those people who need them and would otherwise only have tobacco as an alternative. So, any heavy regulations or restrictions in any regard in terms of banning flavors or the such, it's really just going to put people in a position where they have to go with a more life-threatening alternative, and that would just be a shame. So that's really all I have to say on that.
Thank you for your testimony, sir. I appreciate it.
Thank you for listening.
All right, we're going to move on to our next caller.
Call a 401. Nope, you want to speak for them. Okay, no problem. What I would suggest everybody here, come down already, try to sign up to testify on those so you see what they go through, and you see what they see, because if we can make this process any easier, I will take all feedback, and try to do that, so we're not in a situation. You want me to let it rain when you call through? What's that? You want me to let it rain when you call?
They're not ready. We're getting this phone call as a shock. Put it right here. You don't have the charger?
We got them right here.
Is that iPhone?
Yeah.
I said you got it.
They're all assembled. Somebody pass the Doritos.
does she use that? Excuse me. What? Okay, good.
Hi, Dara.
Hey, what's going on? Who am I speaking to?
This is Representative Casey. I'm the chairman of the Health and Human Services Committee. We have you here to testify on House Bill 5548 regarding vaping. If you could keep your testimony brief, go right ahead.
Say that again?
Go right ahead, sir. You have the floor. We're ready to listen to you.
You caught me unexpected, and I don't know what to say, honestly.
Okay. Are you in favor of the vaping or not?
Yes, I am.
Okay. That's really all we need to know. If you don't have anything to add regarding the benefits of this or how it's helped you, then we're all set with your testimony, and we'll move on to the next person.
Okay.
Thank you very much. Have a great evening. Okay. This is what happens when...
This is what happens when we social media 1,000 people to testify.
Hello, it's Daniel. It's Rhode Island State House. Do you want to testify on House Bill 5548? Yeah, you're having the testimony right now. Would you like to testify on the bill? Which would be 558. Okay, I'm going to transfer it. Okay, just a minute.
Hello, Daniel. This is Representative Casey. I'm the chairman of Health and Human Services Committee. You have our attention regarding House Bill 5548. How are you feeling?
Good.
Okay, go right ahead, sir.
Well, for one is, I don't know why flavors would be taken away, because there's no difference between a flavor and a regular tobacco. You allow regular cigarettes to be smoked, but someone that has a flavor can't. I don't find that right. I actually find it unconstitutional. Who gives you guys the right to take flavors away, but yet you allow people to smoke regular cigarettes? More people die from cigarettes than from vaping.
Okay. Would you like to add anything else?
Yeah, I would like to see flavors brought back. I mean, the Juuls were more of a problem than anything because people were adding illegal stuff into the Juul cartridges, and that's where all your problems happen. And you take people who quit smoking, who might use zero nicotine but have a flavor because they like the flavor, and it keeps them away from smoking a regular cigarette. But yet you want people to go back to buying cigarettes because you want to take this away. I just don't find it right.
Okay, thank you very much. Are there any questions for the witness? Okay, thank you, sir. We're going to move on to our next witness. Hello, Alan. This is Representative Casey calling from the House of Representatives. You're here to testify before the House Health and Human Services Committee on House Bill 5548. Go right ahead, sir.
Hi. Yeah, I just wanted to say that, I'm an adult who uses flavored vape products, and I'd like to continue to have them readily available to me in my home state. And I use these products in order to stay away from regular cigarettes. And I feel banning flavored vape products is detrimental to the health and safety of the people of the state of Rhode Island. It will cause more problems to have these bans than, with with worse results, with things like black market products. Excuse me, and just people doing the wrong thing, like what happened with the THC cartridges and stuff. I think it's wrong to ban it.
Okay, thank you, Alan. Just for my records, your last name is Poisson, is that correct?
Yes.
Thank you. I just want to make sure I get you on the list. Okay, if you have nothing further, I'm going to move on to our next witness, okay?
Okay, thank you.
Thank you very much, sir. Hi, this is Representative Casey from the Health and Human Services Committee. You're here to testify on House Bill 5548. If you would go right ahead, keep your testimony as brief as possible. Thank you.
Sure. I'm sorry. Now I just want to elaborate on something. This is in favor of bringing back flavored e-liquid, right?
That is correct. Can I just get your name, please?
Sure. My name is Suzanne Souza.
Okay, Suzanne, go right ahead.
Okay. I'm absolutely in support of this bill, especially because I was previously employed in Massachusetts, and I firsthand got to see the effects that it had on all my adult consumers. A lot of people don't understand that when transitioning from cigarettes to vaping, or traditional cigarettes, my apologies, is that the flavors actually do really entice them to want to stay with it. And it's been proven more than one occasion to be a healthier alternative to cigarettes. So again, from what I had seen from years, working in the industry, I've seen too many people go back to smoking traditional cigarettes since the flavor ban happened. And unfortunately, loss of a job in the meantime. I wish there was more I could say, but just to keep it brief, from what I've seen, getting rid of flavored e-liquid has done nothing beneficial when aiding adults in quitting smoking.
Thank you, Suzanne. We appreciate your testimony. Are there any questions for Suzanne? If not, we're going to move on to our next witness.
Just give me the name you showed up. Sorry?
Hi, this is Representative Casey from the Health and Human Services Committee. Who am I speaking with?
Veerapong Chandrasanti.
Okay, sir, go right ahead with your testimony, please.
Yep. Thank you for having me. I wanted to express my support for Bill H5548. I'm an adult user of the product. I was a former smoker, and flavors really help play the vital role in helping me, an adult, transition over to vaping and effectively quit smoking. Knowing people who are vape store owners and seeing them lay off their employees or fully close down is truly disheartening when every adult specialized vapor store is on the same mission to rid their community of combustible cigarettes and the detrimental health risks that come with smoking cigarettes. I really want to see them continue their mission to help convert smokers to a healthier alternative, and this bill, without a doubt, would be beneficial to the vaping community as a whole, and people who are looking to switch from cigarettes and vapor businesses. That's all I have.
Thank you, sir, for your testimony. Does anybody have any questions right now? Okay, sir, we're going to move on. Thank you very much.
Yep. Thank you.
Hello, Jennifer?
Yes, hello, this is Representative Casey. How are you tonight? Hello? Okay. Hold on one moment. We have a slight technical difficulty. Hello, Jennifer. This is Representative Casey. Sorry for the delay. You're here for House Bill 5548. If you could keep your testimony as brief as possible, we would appreciate it.
That's okay. Thank you, Representative Casey. I appreciate you hearing me today. As far as the flavored vaping goes, I started smoking when I was a teenager. I was approximately 14 years old, and it was never the taste of the cigarette that drew me to it. Initially, it was just a social thing, and then I got addicted to the nicotine. The only thing that has ever gotten me off of cigarettes was vaping, and I could never vape a tobacco flavor. It's the tobacco flavor is a sickening flavor. Excuse me. I've never been drawn to the flavor of cigarettes, even as a smoker. It's not an appealing flavor. Vaping flavors is the only way to take in nicotine and still get away from cigarettes. I can't see any way that I would still be able to vape and not, and not get away from the taste of cigarettes. I need to be able to vape flavors. There's no way around it for me.
Okay. Well, thank you, Jennifer. Any questions for Jennifer at this moment? Okay, thank you, Jennifer. We're going to move on to our next testimony. Thank you. Hello, Dara.
Hi.
Hi, this is Representative Casey. You're here to testify on House Bill 5548. Please go right ahead and keep it brief if you would.
Hi. Okay, so I support this bill because I believe that flavored vapor products make it a safer alternative, which is much easier to transition for people who wish to stay away from combustible cigarettes, such as myself and many of my friends and loved ones. I just think that having flavor options makes it a much more appealing alternative to adult smokers.
Well, thank you very much, Dara. Does anybody have any questions for the witness? Okay, thank you very much, Dara. We're going to move on to the next witness.
Thank you so much.
All right. Hello, Marina?
Yes.
Hi, Marina. This is Representative Casey. You're here to testify on House Bill 5548. If you would go right ahead, please keep it very brief.
Yes, so first let me say thank everybody for taking the time to listen to my personal testimony. I was a smoker for over 15 years, tried to quit on and off, and first started off with tobacco-flavored e-liquid. It didn't work out. It felt like a forced effort. I knew I wanted to quit smoking, and I would force myself to vape the tobacco liquid. Figured that probably was a lost cause and would go back to smoking. Did go back to smoking fully until I discovered flavored vape juice. So I'm definitely in support of lifting the flavor ban. Once I found a flavor I liked, without even realizing it subconsciously, I started replacing cigarettes for flavored vape juice. And more automatically, I no longer smoke cigarettes, and it's been a couple of years. And on top of that, past my personal testimony, I do think that I think we know anytime the government has passed prohibitions that normally it doesn't work out, it goes underground, it goes on the black market. So I feel much safer purchasing these items from a reputable shop that can speak on the quality as opposed to some random company or vendor online where I don't know what I'm getting or what ingredients are actually in the product. So like I said, I'm definitely in support of lifting the flavor ban. I think it has a lot of potential to help a lot of people increase their health and quit smoking cigarettes, and I think it's been proven time and time again.
Thank you very much, Dara. Are there any questions for the witness? Okay, we're going to move on to the next person. Hi, this is Representative Casey. Who am I speaking to? Hello? Hello, Mitchell?
Yes, sir.
Yes, sir. How you doing? This is Representative Casey. You're here to testify on House Bill 5548. You have our attention. If you could please keep it very brief.
I just wanted to, explain. I personally think vaping flavors and vaping in general helps people out, especially smokers, especially me and my mother. I mean, I used to chew tobacco, my mother used to smoke, and we both switched to that, and we don't do any of the other above anymore.
Excellent, sir.
That was all.
Congratulations on being able to quit. I know it's very difficult. Are there any questions for the witness?
Nope.
Okay, thank you, sir. We're going to move on.
I was just customer service and
Are there any comments or questions from the committee at this time? Okay, we're just waiting to contact another witness. Those of you watching at home, please stay by the phone if you have signed up to testify. We are trying to call everybody we can. We're not having a lot of luck reaching some of the folks, so.
Chairman Casey, this is Rep. Casimiro.
Yes, Rep. Casimiro, go ahead.
I just wanted, one of the things that I forgot to mention in my introduction of the bill was how Governor Raimondo's ban decimated small business and closed many small businesses. So I just wanted to add that because in my effort to be brief, I just felt that this bill really decimated some businesses around. I just wanted to put that out there.
Okay, thank you very much. We do have our next witness. Hello, sir.
Yes, hello.
Yes, could you introduce yourself?
My name is Jesse Colleen. My wife and I are a small business owner in the state of Rhode Island. We do own a vape shop. I was calling to say the same thing. This had almost put us under. With the ban on the flavors, it really, as that lady said, it decimated our business. We own the juice box in Smithfield, Rhode Island. We've been business owners now for about 12 years. In the town of North Smithfield, and when this ban came through, we almost shut our doors about 4 times. I mean, this is making our business very tough in the state of Rhode Island to continue doing business there. We live right near the Connecticut border. We've thought of multiple times of taking our business and moving literally 10 minutes down the road and moving our business to Connecticut. And if this ban persists to go on, we are probably going to take our business and we are going to move our business into a different state just so we can continue to feed our families. We are Christians. We are a married couple with 3 kids, and this is how we pay our bills. And like I said, if this doesn't come back, I'm sorry to say it, that we are going to have to shut our store down for 12 years in the state of Rhode Island and move it out to out of state. That's all I'd like to say. Please bring our flavors back. It would help our business greatly. And also, as being an ex-smoker, it's how I quit smoking.
Thank you,
Jesse. Very much for your time. I didn't mean I won't keep anybody, but that's kind of where we stand.
Thank you, Jesse. We appreciate your testimony. Thank you very much.
Have a great day, everybody.
You
Thank
too.
You.
Okay, we're just waiting for our next call.
Chris, can we just make sure that the list of callers, that we're crossing off everybody that we try to call? Thank you. I'm checking off who we've talked to.
Okay, folks, while we're waiting on phone calls, I'm going to open up another bill. We have no testimony on it. House Bill 5494, this is by Representative Ackerman. It's an act relating to business and professions regarding drug cost transparency. There was not a space in there. I will just give you a quick, brief synopsis of the bill and let you know that we have 2 people who are against the bill. This act would provide cost transparency by requiring reports to be submitted by drug manufacturers, pharmacy benefit managers, and health benefit plan insurers to the Director of the Department of Business Regulation regarding prescription drugs. We have no testimony on verbal, and we have one person from PCMA. His name is Sam Hallemeyer, who is against the bill. And if there's no comment or question, I will close the hearing on House Bill 5494. And that is the definition of multitasking. Okay, we have a caller for 5458. Go right ahead.
Donna, number 79.
Okay, thank you. Hello, Donna. This is Representative Casey, Chairman of the Health and Human Services Committee. You're here on House Bill 5548. If you would keep your testimony brief, we would appreciate it.
Absolutely. Thank you. My name is Donna Dione, and I am a former smoker and currently a vape user, and I have been so for almost 7 years now. And I just wanted to say that I am I do support the bill that is on the table tonight, and I am also a vape shop owner, but I just wanted to just let everybody know there that the flavors do play a very important role for vapors. It helps them to maintain staying off of regular cigarettes. As much as I think a lot of folks think that they don't, they certainly do, and I've lost a lot of customers and a lot of business because of the lack of flavors in the shop. And I've heard that a lot of the customers are going back to regular tobacco-based cigarettes, and it's a very sad state of affairs. So again, I do support the bill, and I hope to see flavors back. And if it takes, getting some sort of license, I certainly do not have a problem with that. And thank you for taking the time to hear me.
Thank you very much, Ms. Dion. Are there any questions from the committee? Okay, we're going to move on to our next testimony. Thank you. Hello, Amy. This is Representative Casey from the Health and Human... Hello, Amy. How are you today? Amy? Hello, Amy?
Hello?
Amy, can you hear me?
Did you hang up?
Hello, Amy?
What do you think that?
I think... Hello, this is Representative Casey. Who am I speaking to? Okay.
I'm going to just confess I'm new on the job.
All right, if everyone can stand by, we're still working on a few callers. Hello, Amy?
Hi there.
Hi there, we've got you. This is Representative Casey from the Health and Human Services Committee. You're here to testify on 5548 regarding vaping. If you could go right ahead, and if you could keep it a little bit brief. Thank you.
Sure, no problem. Since I've been vaping, I can breathe as opposed to when I was smoking. And I see no problem with flavors when all vape shops only sell to people 18 and over or 21 and over, whatever the law is. They require ID, and I think it's ridiculous, and I do support flavors.
Okay, Amy, just for the record, I need your last name if you could, just to make sure we don't miss anybody.
Sure, it's Medeiros, M-E-D.
Okay. All right, thank you very much. Are there any questions for the witness?
No questions.
All right, thank you, ma'am. We're going to call our next person. Thank you.
I gotta go have a cigarette. enough for everybody.
Is it flavor?
I made an announcement earlier, just so you guys know, that if there's a place that's open where we can drink, I'm buying after this.
Hi, this is Representative Casey. You're here on House Bill 5548. Who am I speaking to?
Denise Venancio.
Okay, go right ahead with your testimony, please.
Hi, yes, I'm in favor of this bill. My story is a little bit different. I was an alcoholic for 10 years, and I quit by using flavored vape juice. I am now sober almost 5 years next month and have continued to use vape juice as a way to keep my sobriety. My brother was a cigarette smoker for 10 years and used flavored vape juice to quit and has been tobacco-free for 6 years. I grew up in a family of cigarette smokers and will continue to advocate for the use of vaping products as a way for smoking cessation.
Thank you, sir. If you could, just for the record, could you spell your last name for me? I want to make sure we include everyone on our testimony.
Not a problem. It's V as in Victor, E-R-N-A-N-C-I-O.
Okay, thank you, sir. Are there any questions for the witness? Okay, we're going to move to our next caller. Thank you very much, sir.
Thank you. Have a
Keep it up with that Friday. You should. I'm kidding. We're not going to pay you next week. Have everybody on before the workplace, You got anybody there? You got one. Go up to the house lawn and get the other phone. Plug it in next to me and we'll go.
All right, I'm calling back. Stay close, please.
Yeah, I'm in there.
Hello, this is Representative Casey. Who am I speaking to?
Hi, my name is James Dubriel.
Okay, James, you're here to testify regarding House Bill 5548. Go right ahead, sir.
Oh, hi. Thank you for letting me testify. I do approve the flavors to come back. I was a cigarette smoker since the age of 14, 15 years old. And when I found vaping in 2014, flavors saved my life. And now it's like I can't even get flavors. I've suffered depression and anxiety, and the nicotine and the flavors calm me down. And without flavors, I'm gonna have to be forced to go back to smoking cigarettes, and I really don't want to do it. So I do support flavors to come back.
Okay, thank you very much for your testimony, sir. Are there any questions for the witness? Okay, we're going to move on to our next witness, sir. Thank you very much for calling.
You have a good night, and stay safe, sir.
Thank you.
Get ready, you're going to be falling on the other one. anybody else wants to volunteer to call,
I have to, yeah.
actually, I'll make some calls. I'll let Donovan run this through. I'll get on the phone. I'll give the business some help. That's the problem with virtual testimony. Everybody can stay on the job. If you wanted to testify to the other committee, you have to come to Providence, watch the clock, sit through session, wait for session to get over, wait for the meeting to start, make you turn in line, listen to everybody else, and then go.
I think some people just said, oh, I just want to do that.
Someone signed it. Yep.
Okay, I'll transfer you right now.
Bring them on. Hello, this is Representative Casey. Who am I speaking to?
Hi, it's Carmen Malave.
Well, hello, Carmen. You're here to testify on House Bill 5548. If you would, go right ahead with your testimony, and if you could, just keep it brief. Thank you.
Okay, I work at White Horse River, and I mean, I like it over there. It is like a good environment, and I see a lot of people like quitting, smoking, you know, and I just think it's good because I just hate the smell of cigarettes. It's not, I just think it's disgusting, and people throwing the cigarettes on the streets. I just think it has to stop. Yeah, but
Thank you,
that's my opinion.
Thank you, Carmen. Well, that's what you're here for. You're here to testify and give your opinion on things. If you would, could you please just spell your last name for me so I can make sure we covered everyone?
It's Malave, M-A-L-A-V-E.
Okay. All right, thank you very much. Are there any questions for Carmen? Okay. Thank you, Carmen. We're going to move on to our next testimony.
Okay.
Have a good night.
There are no more on that, I'm sorry? We exhausted the list. Okay.
For the record, those of you listening at home and those of you with us virtually on the committee, we have exhausted the phone call list. There are a number of callers that we could not reach or were unavailable for comment. We do have that all on record, that we did try to reach everybody on the list. And so with that, I will close the hearing on House Bill 5548 by Representative Casimiro, unless there are any comments from the committee or the sponsor. Okay, House Bill 5548 is closed. Representative...
Chairman?
Yes, ma'am.
Chairman, it's Julie. I just wanted to say thank you. You guys were like troopers tonight, so thank you.
You're quite welcome, Julie, and if you want to stay with us, we got 4 more bills to go. Just hang on with us.
I am. I'm going to hang on.
Okay.